Greetings, everyone. Welcome to Be Green with Amy. I'm Amy. After adopting a whole food plant-based lifestyle, my hubby Rick and I lost over 130 pounds. Now I coach others on their plant-based journey. Just Task Voice. Let's welcome our guest.
Dr. Peter Rogers is a Stanford and Harvard-educated MD who for over 30 years has helped people optimize performance for school, sports, and health. He is an imaging-guided surgeon and neuroradiologist who's written nutrition, medical, and study skill books. Please click like to help Be Green with Amy. Welcome, Dr. Peter Rogers.
Greenings, Green Warrior, and welcome back, Dr. Rogers.
Hey.
Green Warrior, do you want to know the most effective ways to protect your brain and prevent dementia before it's too late? Dr. Rogers is here to share strategies, lifestyle tips, and the latest research that most medical doctors don't know to help you maintain a healthy mind and prevent dementia. Well, I'm really looking forward to this because this is something that's on a lot of people's radar with people that are losing memory as they're aging, and they're wondering, is this dementia? You know, I forgot where I put my keys. You know, I'm looking all over for my glasses and they're on top of my head, and it's kind of worrisome. And then you have maybe some friends or relatives that actually are dealing with memory loss, and it's a devastating thing to go through. So we're going to be talking about that today. Green Warrior, if you know somebody that is going through this, tell us about that in the comments. And if you have a question for Dr. Rogers, please go ahead and type them in the comments, and I will ask him your questions a little bit later on in the broadcast. And before Dr. Rogers starts his presentation, we're going to have our little game of true or false.
It's time for True or False on Be Green with Amy Live. Answer true or false to Amy's questions in the comments below, and Amy will ask our guest for the expert answer.
Okay, Green Warrior, tell me what you think, true or false. Dementia is an inevitable part of aging and can't be prevented. Type in your guesses, and while you're doing that, Dr. Rogers, tell us about that.
Yeah, if you eat a Western diet, standard American diet, and even I think the Mediterranean diet to a lesser extent, you're going to develop atherosclerosis and plug up the arteries to your brain and gradually just become stupider and stupider. I can tell you, I got internal medicine doctor friends, and my own experience parallels this, that the vast majority of Americans, by the time they reach 60, they're fat, sick, and stupid. A lot of them in their late 50s. There's kind of this tired, exhausted look, and they've lost that nuance and intellectual vitality. They can still find their way home, but they're no longer capable of any nuanced, sophisticated thinking. They're kind of sad and pathetic. And the reality is, as they become more that way, they never get better, because it takes a little bit of energy to change directions and get your act together and get healthy. And for most people, it's already too late, and they're just on this downhill course. But, it doesn't have to be that way, but that's how most people are.
Yeah, I'm noticing even people in their 50s, like you were saying, and maybe even their 40s, the malaise and the tiredness and just all they want to do is look for things to give them quick energy boosts, and they're having trouble concentrating and remembering, and it's very disturbing. And I'm really glad that you're here to help us learn about that. And we have another question, and after this question, we're going to start with your presentation. Green Warrior, is true or false? Medications prescribed for dementia can help manage symptoms, but not stop the progression of the disease. What do you think about that, Green Warriors? True or false? And while they're typing in their answers, Dr. Rogers, go ahead and tell us about that.
Well, I think, current diagnosis and management of dementia is a big joke, and it really doesn't deserve to be respected. I don't even think conventional medicine really deserves to be considered the standard of care with regard to cognitive impairment. See, the public is sort of hopelessly clueless because they think the medical establishment is designed to help them. It is not. It is designed to make money off you. And no one cares about you. And you need to know that. And it's not based on a Bible-based worldview, man created in the image of God. No, it's based on atheistic Darwinism. You're just a talking primate, a talking monkey. No one cares about you. And once you understand that, you're on your own. No one cares about you. And if you want to do well, you have to learn what you need to do. Then you've got a chance, to not end up like the typical fat, sick, and stupid person.
Well, I'm glad that you said that, because that surely gives us hope that if we can learn from you, that we'll find some strategies and things that we can do to prevent this from happening, because I think it's one of the most devastating things that could happen to someone. Okay, well, why don't we go ahead and do that? Let's start our presentation, and Green Warriors are chiming in. We're going to bring up your presentation in just a minute. I think I just saw, okay. Can't stop lying. Much love, Peter. Great to catch you live, brother. Hope you're having a great week, my man. Just figured I'd give you a little shout out there. And thanks for that, Can't Stop Lying. Okay. And we are going to bring up your presentation now, so you can go ahead and get started.
Okay, you ready for me to start?
Please.
Okay, so here's my first slide. And the point of this slide is to give you hope. I want you to realize there's a lot of stuff that can be done with the central nervous system. It is not a fixed system. It's not like a TV set. You just buy it, it's wired, and that's it. It's constantly making small changes every day, which over time can accumulate and be a big change. So some of the things, and by the way, the schooling system, the grade school, high school, college, it's not there to educate you. It's there to make you conformist and to standardize your belief system. What I'm trying to say is they tell you all kinds of stuff that's not true. First of all, they tell you that IQ can't be increased. That's ridiculous, okay? Anybody can buy a book and study for their SAT and retake it 3 times like I did, and your score can go up tremendous amounts. It's considered an IQ test. Well, there you've just increased your IQ. All you got to do is divide it up into the small components, memory and coding, all kinds of little components, let's say for academics, and you can dramatically improve your performance. All right, so let's just start talking about what are some of the things you could do. Well, first of all, the brain is a use it or lose it system. This is a neuron here. Here's the cell body with the nucleus, mitochondria. These are the dendrites for incoming information. The information is sent to the cell body, this whole region here. When it's excited enough, it'll release its own action potential that travels down the axon to the synaptic terminal here. There should be neurotransmitter vesicle here. They'll release a neurotransmitter, diffuse across to the postsynaptic neuron, and it exerts an effect on the postsynaptic neuron. But the point I want to make is this fatty coating of the neuron axon is to speed up conduction. And the more you use that neuron, the thicker this fatty coating gets. Now, this is a good thing in this location, and it'll speed up transmission. So what I'm saying is, if you want to preserve a cognitive function, the more you use it, the better you will get at it, the faster you will get at it. So that could be hitting a tennis ball, it could be reading, it could be conversing on a certain subject, whatever it is. So you want to keep on using your brain in an active way. The more you use your brain, the more it adjusts that system to make it work better. For example, if an area of the brain is highly active, you'll get the formation of new capillaries. That's called angiogenesis. This is good angiogenesis, to supply more blood flow to an active part of your brain. Let's say you start taking piano. You'll get more capillaries to the part of the fingers and the auditory system related to piano. When you exercise, you get increased BDNF, brain-derived neurotrophic growth factor, and that also stimulates the health and the growth of neurons. We all day long are forming new synapses. Those are the connections between two neurons, like this right here, like these neurons being connected here. That's synaptogenesis, all day long, nonstop. But we also can form entire new neurons. That's called neurogenesis, and BDNF also stimulates this. And we form them in response to walking, in response to new learning. So you want to do the things that increase that, get some exercise and engage in some intellectual activity. You want to avoid the things that diminish that. Excessive psychological stress, lack of sleep, sleep deprivation, caffeine, head trauma, all of those things will diminish your ability to make BDNF and have neurogenesis, okay? So they make you stupider. So you want to avoid the things that make you stupider. They all raise the same hormones, cortisol and catecholamines. You also want to maintain your blood-brain barrier. There's a barrier between the brain and the rest of the body, because after you eat a meal, all kinds of chemicals increase in your blood. But you can't have that happening in your brain parenchyma, because if you were to disrupt the neuronal milieu, the microenvironment around the nerves, their action potentials would not be able to conduct properly. So you have to have an intact blood-brain barrier. What happens, though, is the same things that cause a leaky gut, they also cause leaky blood-brain barrier. For example, it's the fiber that leads to the bacteria in the gut making short-chain fatty acids like butyrate, 4-carbon butanoic acid. That not only maintains the gut lining, it goes up to the brain and it maintains the brain endothelial cells. And that maintains your blood-brain barrier. These little blue blocks between these cells here, those are the blood-brain barrier tight junctions. So what I'm saying is if you don't maintain your gut barrier, you're probably not maintaining your blood-brain barrier, and you're going to get brain fog, because when chemicals seep into the neuronal milieu, extracellular matrix, they can interrupt neuronal conduction because it's an electrical process. It'd be like making little cuts, little nicks in the plastic insulator around your wire of your electronic devices. Okay, so anyways, these are all good things you can do. Also, the more you use your brain, the more you'll store glycogen, and exercise does this in particular. Glycogen in the supporting cells, the astrocytes. This is called a tripartite synapse. First neuron here, neuron number 1, neuron number 2, and then the astrocyte. They're also sometimes called the mama cells, and they help make this synaptic junction function. So your exercise helps that. So these are a whole bunch of things you can do. It's pretty obvious. And then you also have your immune system cells in the brain called macrophages, or actually we usually call them microglia. And the relevance is that they're normally supposed to be kind of sleeping. You want them to be like the Maytag repairman, a sleepy security guard, not doing anything. If they get activated, they can be activated by head trauma. They can be activated by some toxic chemicals. They can be activated by excessive psychological stress. Then they start releasing inflammatory chemicals that can damage the nerves. So one thing I want to show you too is here's a brain. This is a transection. So if you cut this way of the upper part of the brain called the centrum semiovale. Cortex means bark, like the bark of a tree. So that's the gray matter ribbon all along the periphery of the brain. And here's the deep white matter, meaning the myelinated axons. Okay, so here's a stroke. When you have a stroke, it looks kind of like an egg. The center where the yolk would be of an egg, that is the dead brain. We call that the central core infarct, dead brain in a stroke. In the periphery of that, though, you've got what is called a penumbra. Penumbra means twilight. This is the brain that's salvageable. So anytime there's a significant brain injury, there's always a couple brain cells that are dead, and then there's a whole bunch right on the margin of it that could live or could die, depending on what happens in the next couple of minutes, next couple of days, next couple of weeks. So you just want to always have good brain habits so that even if you lose a couple brain cells, the penumbra will stay intact. And it's a little bit like the concept in the heart of stunned myocardium or hibernating myocardium, meaning cells that are quiescent or non-functional but can be restored to normal function. And you restore them by good brain habits. Like I said, you protect your blood-brain barrier, you give your brain good nutrition, you don't plug up your arteries, and you avoid things that are toxic, all your toxins. Okay, here's the next slide. Actually, I'll just stay on this thing. Let me see here. This is just a 3-part brain. It kind of looks like if you hold your fist up, that's the brain stem. And, the part sticking out in the front, that's like the belly of the pons. The little fingers that stick up, the knuckles of the first 2 fingers, that's the midbrain. And then down below is the connection between the medulla and the spinal cord. And that's sort of like we call this the reptile brain. The reptile brain is real primitive. A reptile lays a couple eggs and walks away. It's got a pretty easy life. And then the next step up in the brain, what I'm giving you right here is called the 3-part brain of MacLean. He was a Harvard neuroanatomist. And this concept it's useful for talking about the brain. The next thing in the middle is called the mammal brain. The mammal brain, this right here is the corpus callosum. Okay. This right here is the cingulate gyrus. And this part right here is called the isthmus. It connects to the medial temporal lobe. And this is the mammal brain. The mammal brain is more sophisticated than the reptile brain because the mammal has live-born young, has to nurse them, has to protect them, has to help them along in life. But it's still very impulsive. And it's shaped like the letter C on a Chicago Bears football helmet. And when we're stressed out, we go into mammal brain, so to speak. Then the uppermost brain on top is the supratentorial. There's like a tent separating the upper brain and the lower brain. So we call this a supratentorial brain, the primate brain, the human brain with the cerebral cortex. And this is the more sophisticated type of thinking, like the ability to accept delayed gratification, to do the thing that you should do even though you don't want to do it. You can to enable yourself to be thoughtful. Okay. And so what I'm basically saying is, why is it worth knowing this? Well, let's say you're arguing with your boyfriend, your girlfriend, okay, and you feel like saying something really mean because you think it's funny, but you know they get really pissed off and hurt and never forget it for the rest of their life. So you say to yourself, you know what? I can hold my tongue. I just won't say that. And, you know, we'll talk about this tomorrow or something. You can use your rational judgment to come up with a better solution than just what you feel like doing as an impulse, okay? Take a look at the movie Gone with the Wind, Rhett Butler and Scarlett, especially Scarlett, always popping off at the mouth, saying mean things, and then ruining the relationship. So you don't want to do that a lot of times. You want to say, I'll be nice. I'll eat a little bit of crap right now, and that'll make things better in the long run. This will be okay. So anyways, that's part of the ability to recognize, am I going into a mammal impulsive state where I'm saying something or behaving stupid that I might regret long term? That's a valuable thing. So it's called metacognition, to think about your thinking. Another little trick here is the cerebellum. Cerebellum, what percentage of neurons do you think that has of the total brain neurons? The brain's got about 100 billion neurons. Cerebellum actually has about 70% of the neurons in your brain. And the relevance is they're short interneurons connecting motor fibers so that you can very precisely coordinate. Like if you want to write your name with a pen, that actually takes a tremendous amount of coordination to do it just right. Chimps can't write their name. Okay, so 70% of your neurons are down here because they're short in length. A lot of these neurons are really long. They go all the way from the brain down into the spinal cord, and they're associated with all these long pathways. All right. And that brings us something called Moravec's paradox. Moravec's paradox was the hard thing was easy, the easy thing was hard. We used to think that, a smart brain is a brain that can do calculus or something like that. But they could easily make a computer do calculus by the 1950s, 1960s, whereas they still can't quite make a computer machine robot move like a human. It takes tremendously more neural resources to have coordinated motion than it does to do math problems, for example. So that's called Moravec's paradox. And that's another reason why you want to exercise, because when you exercise, you're using a tremendously large amount of your brain. And like a wonderful thing would be like dancing, okay? Dancing, you have to socially interact with another human, listen to the music, move yourself in a coordinated fashion. It's tremendously kind of good for the brain as long as the music's not too loud. Okay, here's where your main memory center is for declarative memory, meaning something that you could say back. Today I went to the store, okay? And so this is the hippocampus. Okay, it's the college with the fattest students, the hippocampus. All right, anyways, that's where you store memories, where they first come in. When you store a memory, what you're doing is you basically take information and you connect it to something. You associate it with something you already know, typically by comparison. This, says bow wow and it has 4 legs, therefore it is a dog. This says meow with 4 legs, therefore it is a cat. So that's how we map cognitive space in the world, is by comparisons, by analogies, metaphors, okay? And the more you know, the more you can learn, because you got that scaffolding system to compare new information. Here's the glymphatic system. It's a combination of the words glial, supporting cells of the brain, and lymphatics. There's no lymphatics actually in the brain parenchyma itself, but there is lymphatics in the outer part of the brain covering. They're called the meninges, the outer layer, the dura. Okay, so what's the point of all this? Where the artery, this red is for an artery, comes into the brain parenchyma, the penetrating artery, there's a little bit of cerebral spinal fluid that tracks around the artery. This is called the perivascular space. The entire word is perivascular space of Virchow-Robin. And what happens is the brain can't go offline at night because it has to function effectively, maintain the microenvironment like we spoke about earlier. But at night while you're sleeping, the brain can go offline, and it can open up these perivascular spaces and allow more cerebral spinal fluid to float around these arteries and then to pass a little bit into the brain parenchyma. And the neurons at night will pump out their waste products, kind of like Victorians dumping out their chamber pots from the upstairs window onto the street. And then the cerebral spinal fluid rinses it away. That's called the glial lymphatic system. And it'll rinse it into the CSF, and there's something at the top of the brain called arachnoid granulations, where you can clear it out of the system. You can also clear some of it out actually in the capillaries as well. But the point that I'm trying to make here is while you are asleep, your brain is cleaning itself. The neurons cannot go offline in the day. They can't clean themselves in the day. So they do it at night. And that's why you're always smartest first thing in the morning. And it makes sense. Lots of things in biology make sense when you understand them. When does an animal need to be smart? It needs to be smart when it's hungry. After break fast, you haven't eaten since at least last night. You need to, be with it in the morning to go find some more food. That's why you get a little burst of cortisol in the morning, and that gives you more energy and maintains your blood glucose for a while until you can find some food. So here's just, an obvious picture here. These are the Pima. They now live in Arizona. They used to live in what is northern Mexico, along with the Tarahumara. They're sort of genetically about the same, demographically matched populations. Mexican-American War, 1848. The Tarahumara stayed in northern Mexico, what is now called Sierra Madre Mountains, Copper Canyon area, whereas the Pima were pulled into Arizona, and they now eat the standard American diet. They're all typically fat and sick, and they get all the typical Western surgeries, Western diseases, obesity, diabetes, hypertension, coronary artery disease. Just like they say, MJ is the gateway drug for, turning into a screw up. Obesity, diabetes, hypertension are the gateway diseases for destroying the whole human body. That's the main thing people have in Western society. And the good news is they're dietary diseases, meaning you are in charge of them. Change your diet. And you can't fix them with a pill. You can't cure a dietary disease with a pill. It's a big joke, okay? So that's what all the stupid people do. I talk to a lot of stupid people, and they always say, my diabetes is under control. It's under control. And they don't understand. What you want to do is prevent diabetes. Why take a pill or an injection the rest of your life and have all kinds of complications when you could just improve your diet and be cured most of the time, as long as you still got pancreatic beta cells still making insulin. Okay, and the Tarahumara, they're world famous. They run 100 miles in like 2 days. They also they eat a lot of corn, a lot of greens, local beans, squash, low-fat plant-based diet. Here's my cross-country team when I was in high school, and I learned something pretty valuable from that. The cross-country team were by far the smartest kids in the school. I went to a big high school, over like 1,000 kids in every class, and all of the highest SAT scores, they came from the cross-country team. A lot of these guys, they're all in the 1,300s, 1,400s. And that was a good experience for me. Running makes people smart. Cross-country running, because it's the same discipline. I will push myself for 1 more mile. It's that same discipline that says I will study. I will do what I'm supposed to. That was a great experience for me, because then I got a lot smarter too. I was pissed off that they had scored higher than me on the SAT test. So I took it over again. I just bought a little book on my own, studied, went through all the questions. My score went up like 270 points. A lot. More than that. It went up a lot. So anyways, it was worth the time. So if that's my IQ, how could I increase my IQ so much? All right. Here's a sea squirt. It's an animal when it's juvenile. It swims around like a tadpole, and it has a brain. When it's an adult, the sea squirt attaches to a rock, and then its brain is reabsorbed because it functions as a filter feeder. You don't need a brain if you just sit on the couch all day watching TV. So what I'm trying to say is, use it or lose it. You got to keep exercising and moving. That's one of the best things you could do to protect your brain. Oh, I like the Voltaire question. Why do animals have brains, but plants do not? Because animals move. Okay, as soon as you start moving, you need to have a brain because you have to make a value judgment. I shall walk towards the fruit tree and get something to eat. I'll avoid the coyotes over there. They might bite me. I don't like that. You have to navigate. You have to avoid objects. You have to have a memory to remember how to get back where you came from. So you need to have a brain. Motion actually takes brains. And then you ask yourself, too, what is the purpose of a brain? The reason why you have a brain, the brain is not BS. The brain does not change its pronouns every 6 months, okay? The brain is so you survive, all right? And so the purpose of your brain is you can walk down a path in a forest, a jungle, a prairie, or in the modern world, somewhere else, in a city or something, and you could survive, okay? It has to deal with reality or you're dead. You want good information. All right, here's a typical thing I'll do is I'll come home from work and I'll walk around reading a book in circles in my house, as long as nobody's home, so I'm not annoying them. Or if no one's home, I'll listen to an audiobook even, and while I make my dinner or something. Or sometimes I'll just watch YouTube videos. But walking around, I would get exercise simultaneously. Okay, high-fat diets produce lots of coronary artery atherosclerosis down here, and they produce some carotid artery. This is the cervical neck carotid artery atherosclerosis. Hypertension causes a lot of intracranial atherosclerosis. So this has been called Western atherosclerosis from high-fat diets, whereas intracranial atherosclerosis has been called Asian atherosclerosis. And the reason the Japanese used to get this because they were smoking like chimneys, and they also used to put tons of sodium on their food, like 12, 14 grams a day, tons of it. And that's why even though they were relatively healthy, they had a lot of strokes. The bottom line is if you eat the Western diet, you're screwed. You're going to plug up your arteries and have other problems. You're going to be fat, sick, and stupid, late 50s or early 60s typically, sometimes sooner. Here's the East Asian diet we kind of just talked about, that it was healthy with the white rice and healthy with all the vegetables, but not so good with the high tobacco and high sodium. Then there's the South Asian diet, the Indian diet. And the thing that gets them in trouble, a lot of Indians, they look pretty healthy. They'll tell you, oh, I'm a vegetarian. They're skinny. You think they're really healthy, but it turns out they got problems. And the main thing getting them into trouble, they eat a little bit of dairy, a little bit of sat fat, the ghee and the yogurt. But the main thing that gets them in trouble is they eat a lot of fried food. They have a lot of sodium too, but it's the fried food that they eat a ton of it typically. And so they end up having a lot of diabetes, coronary artery disease because of that. Like I had an Indian friend, a doctor, Indian friend, and I hadn't seen the guy for months. Then I see him and I'm like, hey, how you doing? What's new? I go, how come I haven't seen you in a while? He goes, well, because I was dead. I go, what do you mean you were dead? He goes, I had a heart attack. I had to be defibrillated, resuscitated, brought back to life. And, I was in rehab for a while. I said, oh. I go, well, why would you get that? I thought you were a vegetarian. I know you exercise a lot. And he goes, yeah, I do. And I go, why'd you get it? He's like, I don't know. And I go, do you fry your food? Do you eat fried food? He goes, do you cook with oil? And he goes, yeah, of course, you have to. I said, no, you don't. That's the reason. Okay, look at a low-fat, low-sodium vegan with no oil. They're low on all this stuff. That's how you win the game of health right there. That's the holy grail of health. Immaculate consumption. That's it. Take it or leave it. Smart person takes it. A chump ignores it. Most people are chumps. Okay, what's the difference between plant and animal foods? The good stuff's in the plant foods. You get the fiber. That protects your gut barrier, prevents leaky gut, and also prevents leaky blood-brain barrier. Okay, protects your blood-brain barrier. That's important. Not to mention it does all kinds of other good things. It prevents abdominal pressure syndrome, etc. P for plants, P for potassium. You also get magnesium. Magnesium is right in the center of chlorophyll. Those are both vasodilators. They keep your arteries open. You need these guys to effectively run your plasma membrane potassium sodium pumps. Super important. Why are most people deficient in these three things? Because Americans don't eat enough plants. Okay. You also get nitrates from the plants, like from your leafy greens. Nitrates are the precursors for making nitric oxide. We'll talk about that a little more in a moment. You get your antioxidants, your vitamin C, etc. Complex carbohydrates are a good energy source for the brain. And complex carbohydrate is also called a starch. It's basically a polymer of glucose wrapped in fiber. And it takes time for the intestinal enzymes to peel off the fiber. So you get this slow absorption of blood glucose, like a prolonged, slow release energy pill. That's what you want. And also because it's low caloric density, it stretches your stomach, early satisfaction, hunger, and then it's slowly absorbed as the fiber's peeled off. And so you just keep your blood glucose in a normal zone for a prolonged amount of time. You satisfy your hunger with the fewest number of calories. That keeps you skinny and healthy and energetic. That's what you want. Here's meat. The only thing meat has that plants don't is meat will have more B12. The meat doesn't make it. It comes from like bacteria. And but nowadays we wash all the plants off so much and all the fertilizers and other stuff sprayed on them that people who only eat plants have a good chance of being low in it. I just take vitamin B12, methylcobalamin form. That's the only thing I take. That's the only supplement I take of any kind. Okay, look at all the bad stuff in meat. Lots of saturated fat, lots of animal protein. These are all got all kinds of problems. Obesogenic, insulin resistance, tissue hypoxia, activation of mTOR with animal protein because you got more leucine, methionine, etc. I don't want to go through all this. I'll bore you to tears, but I'm just telling you, all the bad stuff's in meat. Bioaccumulated herbicides and pesticides, advanced glycation end products, intrinsic to the meat itself, more arachidonic acid, the omega-6, that's sort of pro-inflammatory. I'm not talking about the parent essential fatty acids. I'm talking about like the long chain, farther along the path ones, elongated ones. The estrogenics to fatten up the animal, get it to slaughterhouse faster. The heme iron more absorbed, get your iron overloaded. Tends to be stored and flavored in excess sodium, often fried. Xenocyolitis from the sialic acids. I'm not going to get into all that. There's viruses intrinsic to the animal foods like bovine leukemia virus, TMAO, etc. Okay. And even things that people think are good. Oh, omega-3s in fish. No, fish is for chumps, okay? The lady, I think her name was Jane Hightower, wrote that book about how all these yuppies were getting demented. They're trying to be healthy eating fish, and they're making themselves demented because of all the contamination with HG. Not to mention O3s are overrated. They're immune suppressants. They increase your risk of AFib. They increase the risk of obesity, of insulin resistance, immunosuppression, increased prostate cancer. Anything that increased prostate cancer is probably going to increase breast cancer. I would avoid them. I wouldn't take them. You get plenty of low-fat plant foods. Here's a book I wrote about a year ago. It's the best book ever written on dementia. These are my wrestling coaches in college, world and Olympic champions. That's Dave Schultz and that's Mark Schultz. I learned more from them than any of my Stanford professors. I did a sort of informal study. I look at tons of demented brains, thousands of them. And what I notice is that 90% of the patients have both diabetes or prediabetes and hypertension. Almost all of these same patients will have coronary artery disease. Most of them have had cataract surgery on at least one side. The eyes are the window to the brain, and they're also the window to dementia. You start screwing up the eyes, you're likely screwing up the brain not too far behind, so you got to be careful about that. They typically have poor dentition. When you don't just get leaky gut, you can get leaky gums from not taking care of your teeth well. And then about 50 of them will have either diabetes or hypertension. So-called Alzheimer's has been called type 3 diabetes. That's sort of a topic for another day, but there's something funny about that I might get to later. Let's see here. Most diabetics are hypertensive. All this stuff just goes together. Diabetes and hypertension go together. They're Dumb and Dumber. A lot of these heart diseases are just atherosclerosis. You can get congestive heart failure because you plug up the microvasculature in the cardiac muscle. Atrial fibrillation, same thing. Okay. Let's see. Hyperlipidemia is a major problem. And just because a statin can lower your total cholesterol number, it doesn't mean that your lipids are good. You can still have atherosclerosis. A smart move is fix it with diet as much as you can. Most of them are overweight, not all. A lot of them got sleep apnea. Sleep apnea patients are some of the stupidest people I ever talked to. The three stupidest groups of patients are sleep apnea patients, renal failure patients on dialysis, and diabetics. They're just routinely cognitively slow. Cigarette smokers, yeah, that's a bad habit. Alcoholics, alcohol is directly toxic to the brain. Oh, I like this quote from Ayn Rand. She said, drugs are for people with a flawed philosophy. If you are a highly motivated individual trying to do something good with your life, why would you want to poison your brain with a drug? It's totally stupid. Okay. Yeah, we got so stoned. Well, why would you want to do that? Why would you want to poison your brain? Because you're stupid. You don't know what to do with yourself. Okay, traumatic brain injury, that causes a lot of brain damage. A lot of things, too, like people think it's smart to have their kid play soccer. No, it's stupid. The kid hits the ball with their head. It's like volunteering to be punched in the head. It's completely stupid. Unless they forbid heading, then you should not play soccer. You shouldn't be in any sport where there's any type of head trauma. You need your brain your whole life, The glory of high school, that will come and go. You need your brain every day the rest of your life. Yeah, I'll occasionally see dementia due to Parkinson's or something like that, but all that stuff is super rare. A lot of women are getting demented because they had hysterectomies. That's not widely known. But if a woman has a hysterectomy before she's 35 years of age, she basically becomes like a man in terms of her blood physiology, and she's prone to all the problems men have, but she's less aware of them because her premenopausal girlfriends, they're not having myocardial infarctions. They're not worried about becoming impotent. So they tend to get relatively advanced hypertension and atherosclerotic disease without even realizing it. Whenever I get a demented female, let's say at a relatively young age, between 45 to 60, first thing I do is I look and see if she had a hysterectomy. I mean, I check for the usual suspects. Is she an alcoholic? Is she a drug addict? That kind of stuff. But it's usually because she had a hysterectomy for fibroids. People say, oh, we got to get a head CT, brain MRI. Patients having cognitive impairment, we want to make sure they don't have a treatable cause like a meningioma. You know how rare that is? I see a meningioma, benign brain tumor, causing cognitive impairment about once every 15 years. It's so rare, it's not even funny. How often do I see treatable communicating hydrocephalus, normal pressure hydrocephalus, MPH, that will respond and the patient will have a good result, cognitive improvement? Super rare. Once a year, it's really rare. Okay. How often do I see diabetes, hypertension related cognitive impairment? All day long, every day. Okay. Nonstop. Something like a treatable subdural. Yeah, you'll see those. You'll see those a little more often than this other stuff, but still not that much. Okay, bacteria, major bacterial meningitis, encephalitis, pretty rare. You'll see cysticercosis if you're down near Mexico, but it's pretty rare the farther you get from Mexico. Reversible, cognitive impairment due to syphilis, like Al Capone, maybe like Nietzsche, and some of the other ones, Winston Churchill's father, a few other ones. But in the 1800s, maybe it was common. In the modern world, it's rare. I almost never see dementia due to syphilis. Lyme disease, theoretically, Chris Christopherson was thought to have had that, and then he got it treated and he got better, but it's pretty rare. West Nile virus, mad cow. You know how rare mad cow is? I've seen mad cow twice in the last 20 years. It's a rare, rare disease. Autoimmune encephalitis, something similar. I see about one case every 5 years. Paraneoplastic encephalitis, I see about one case every 10 years. It's super rare. Okay, and sometimes everything looks totally normal. Nobody knows why the patient's demented. Okay, there's other things that can do it. You could be hypothyroid. You could have, some people are just really stupid to begin with. You could have B12 deficiency, thiamine deficiency, alcoholism, of course, I talked about that. Sometimes there's other toxic exposures, like they have a strange job where there's some toxic exposure. Okay, and then there's tons of things that contribute to dementia. I haven't even begun to list all the things that occur with dementia. But I just want you to know, here's standard conventional medicine's approach to cognitive impairment. Most of the time, they just go, well, it looks like the patient has Alzheimer's. Nothing really works for it, but just take this pill. It might help. And I want you to realize that's completely stupid. And here's why Alzheimer's dementia is a joke. If you just go to any doctor, go to a neurologist, okay, and you go, what's the most common cause of dementia? Statistically speaking, they're probably going to tell you it's Alzheimer's. Everybody knows it's Alzheimer's. Well, why do you know it's Alzheimer's? Because somebody told them that. What ended up happening is to get more research funding. Let's say you're asking, say, I need, $1 million to do a research study on Alzheimer's. You want to say Alzheimer's is so common. It's the most common cause of dementia. So the people trying to get funding for Alzheimer's, you did this huge campaign to promote it and make everybody think it's the most common cause of dementia. And because of that, everybody who hasn't studied it thinks it is. It's kind of like what the Mediterranean diet is to recommending nutrition. Alzheimer's dementia is to diagnosing dementia. Everybody just goes, Alzheimer's is the best diet. That's because they don't know what they're talking about. It's a terrible diet. Okay, so what I'm trying to say is, how do you diagnose Alzheimer's? You can ask the patient a question. Nope, there's nothing. There's no question that tells you they got Alzheimer's. Can you put a stethoscope on them? Nope, there's no physical exam finding. Can you do a blood test? Nope, there's no reliable blood test. Well, we can image it, right? Do a CAT scan, do an MRI. There's not a reliable test. I look at thousands of these things. I almost never see that so-called pattern of focal parietal lobe atrophy along the convexities and medial temporal lobe. Yeah, right. Okay, well, of course, we know we can diagnose it at autopsy, right? Extracellular senile plaques, intercellular neurofibrillary tangles, pathognomonic BS. They can't even do that. You'll have patients that don't have any evidence of Alzheimer's having those things. Patients who are supposedly for sure Alzheimer's don't have them. That's where that cognitive reserve theory came out of Mount Cottle, Minnesota, Notre Dame nuns who donated their brains to science at their death. The ones who read a lot would have intact brains despite having a whole bunch of these findings typical of Alzheimer's, senile plaques and neurofibrillary tangles. And the ones who hadn't, with relatively few, might have so-called Alzheimer's dementia. So it's kind of BS. And then what about the treatment? Can they treat it and reverse it or cure it? No. So what I'm trying to say is use your brain. If you can't diagnose it when the patient's alive and you can't diagnose it when they're dead and you have no way to treat it, what is that? That's BS, okay? So get that through your head. Alzheimer's is BS. It's an embarrassment. And now I'm going to show you a smart guy. Here's a smart guy, Jack Delatorre. He's a researcher. He wrote this book. It's a great book called Alzheimer's Turning Point. One of the best books ever written about dementia, other than mine, of course. All right, so here's Delatorre, and here's what he did. He tied off the carotid artery in the neck of a mouse, and he then saw that middle-aged and older mice would become demented 2 months later. So he did an autopsy on him, and he's expecting to see, a big stroke on the side he tied off the carotid, but there's no stroke. The brain was simply shrunken on the side where he tied it off. And he experimented. He tied off both carotids. He tied off the arteries in the back of the brain called the vertebral arteries. He went up into the head, tied off the middle cerebral artery. And every time he got the same pattern of progressive atrophy, shrinkage of the brain in the area where the blood supply had been denied. And he came up with what he calls the vascular hypothesis of dementia. And the first thing you're going to think about if you've seen a lot of patients with vascular disease is not that many patients have severe stenosis or occlusion in the carotid artery of the neck. That's true. But guess what? Lots of patients have diminished blood supply to the brain. How about atrial fibrillation? We see that all the time. You lose atrial filling, you're like the mouse. I call these mouse equivalents. I made that term. Congestive heart failure. You don't got good cardiac pumping, decreased ejection fraction. You don't get enough blood up to the brain. You're like the mouse. Okay, let's say you have hypertension and you overtreat it. The drug company's lowering the guidelines to get more people on meds, and the patient doesn't understand, and they're keeping their systolic pressure real low. They are overtreating their hypertension. They don't got enough blood supply to the brain. They're like the mouse, vascular hypoperfusion. Those neurons aren't getting enough glucose and oxygen. They're going to gradually start dying. Okay, I mean, it takes a couple of decades to play its way out, but this is what happens. You're going to have aortic valve disease, aortic stenosis, aortic regurgitation, post-CABG, coronary artery bypass graft, open heart surgery, coronary artery disease. My father had that. Gosh, now that was about over 20 years ago, about 25 years ago. At the time, I told him not to do it, but I didn't know enough. And I got the cardiologist, the cardiothoracic surgeon saying he's got a widowmaker in the left main, he needs to go to the OR. And I didn't know enough then that I could stand up to them. Now I could easily, but back then I didn't. And he went to the OR, and he came out of it pretty well. He ended up having a stroke 4 years later, though, because they stapled the lima to the LAD, left internal mammary artery, to the left anterior descending coronary artery, and it's fixated. And then he was shoveling snow, throwing the snow over his shoulder. He dissected his vertebral artery, meaning he injured the artery, formed a clot in it, it embolized, traveled distally into the brain, and then gave him a stroke. And the stroke, he was still able to talk, but he wasn't able to work anymore, and it made him pretty sad. He lived, the last 10 years of his life, half stroked out. It was pretty sad. Okay, so anyways, that's the dilatory theory of vascular hypothesis. He calls it chronic cerebral hypoperfusion of dementia, and it's very valuable and it's very useful, and that is the correct way to think about the brain. Okay, so here's another example of the blood supply to the brain. Here's a carotid artery, comes up into the brain. There's an anterior cerebral artery, runs down the midline. I didn't draw it on here because it's too complicated. I drew the middle cerebral artery here, and this comes up along the cerebral convexities. They're called convexities because they're convex outward. All right, and then you got these penetrating arteries that go down into the deep parenchyma of the brain. You got these ones coming out. These are called lenticulostrides. This level is called the basal ganglia. And I put a skull and crossbone here because this is where I see strokes all day long. One patient can have over 100 strokes in this area due to hypoperfusion, like Delatorre's problem. So you're kind of damned if you do, damned if you don't with hypertension. If you overtreat it, you drop the perfusion pressure and you don't get enough blood to this area. Okay, if you undertreat it and you really do have bad hypertension with systolics routinely sustainable over 160, you're going to be injuring these arteries, causing a reactive phenomenon that thickens the wall and blocks oxygen delivery to the tissue. So you want to keep the blood pressure in a reasonably normal range. Let's say a systolic, between 90 to 150. Okay, something like that would be reasonable. All right, so by the way, here's the most common thing I see with demented brains. Here's a normal looking brain, let's say for a 70-year-old. This would be a very normal looking brain. I would describe this as a tight brain. When I say a tight brain, what I mean is the brain parenchyma is up tight against the inner table of the skull. Okay, this is the skull, this big white thing outlining the brain here. Here's the inner table and the outer table. So when the brain is close, that's typical of a young brain, all right? I would say on average, this looks like about a 65-year-old's brain, a healthy 65-year-old. There's a little bit of atrophy. These sulci are a little bit big, but this is a pretty normal-looking brain. All right, now here would be a demented person. And when I say demented, they don't have to be demented, but I would just say this is a typical appearance of a cognitively impaired demented brain. And this would be a loose brain. See how there's a lot of fluid here? All this dark stuff is the fluid, cerebrospinal fluid. There's lots of fluid separating the brain parenchyma from the inner table of the skull. And that's because the brain has shrunk down. And this is what I see all day long, every day. It's the most common thing I see in dementia is just the brain is shrunken. Okay, now here again is a normal brain. That last set of images was a CAT scan. So the skull is all kind of whited out. It's based on density and the fluid is dark. Okay, now here is a brain MRI. This is actually a flare sequence. You don't need to know what that means, but you just need to know this is normal. Again, you've got the brain up tight against the skull. The cerebral ventricles are relatively small. They're normal in size. This is a normal looking brain. Okay, now here's a typical crappy looking brain that I see again all day long. This would be like a cognitively impaired 80-year-old. Pretty typical appearance for a cognitively impaired 80-year-old. All these white spots, we call brightness in hyperintensity. We call these extensive juxtaventricular, periventricular, and subcortical flare hyperintensities, most likely due to chronic cerebrovascular small vessel ischemic disease. Okay, that's a fancy way of saying is they don't got enough blood flow to these parts of this brain, so they're stroked out. Now, these strokes often are silent strokes, meaning that the patient doesn't have a physical deficit, like they're not hemiplegic, but they're just progressively slowing down cognitively, maybe walking in a walker, for example. But again, you don't even have to have any strokes. All you got to do is have a shrunken brain. You can even have it with none of these strokes, and the patient will be significantly cognitively impaired. All right, so this is why I talk about the Goldilocks balance with hypertension. If your pressure is too high, you're smacking against the median divider at bifurcations, damaging the arterial walls. If your pressure is too low, you don't get blood supply to the tissue. The reason you got a blood pressure is to get blood to the top of your brain. You have to pump against gravity. The highest thing that's significant from your heart is the top of your brain. So that's why you have a blood pressure. Now, if you're pumping normal blood, it's relatively thin like water. You don't need that much pressure to get it up to the top of your brain. But if you're eating a high-fat diet, it sticks your red blood cells together. Now you're pumping a milkshake instead of water, so you got to pump at a higher pressure to get it up there to the brain. Eat a lot of sodium. It's a vasoconstrictor. It clamps down on your arteries, so you're pumping through a constricted system. You need to pump at a higher pressure to get blood to the top of your brain, your cerebral cortex. So that's what I meant by the Goldilocks and the three bears concept. So if your pressure's too high, you damage the arteries. If your pressure's too low, you don't get it up to the top of your brain, and you end up being screwed either way over the course of a couple of decades. So here is some intracranial bleeds. Now, just for perspective, this is a big interparenchymal hemorrhage. This big white spot is a big acute bleed. These are rare. I only see a big hypertensive hemorrhage like this about once a year. Okay. We call it an IPH, intraparenchymal hemorrhage. Okay. So anyways, these little black spots, now these are hypointensity, as we call it, when things are dark on MRI. This is a SWI MRI sequence of the brain, susceptibility weighted image. And all these little tiny black spots, this is actually called the differential diagnosis for multiple black dots. Okay, these are a bunch of small intracranial bleeds. We can also call them CMBs, cerebral microbleeds. The concentration of these bleeds in the basal ganglia is very characteristic of hypertension. So this would be a typical hypertension appearance of microbleeds. The microbleeds in the periphery is the characteristic appearance of cerebral amyloid angiopathy, which is typical of Alzheimer's disease. So what I'm trying to tell you is I see patients all the time in their 40s and their 50s that have this pattern. So the patients don't read the books. What I'm trying to say is they don't routinely have a characteristic peripheral pattern and have Alzheimer's, or have a characteristic central pattern and just have hypertension. They do a lot of times get a central pattern, but I see a combination and a spectrum all the time. I see this every day. I usually see, a couple cerebral microbleeds every day, and some patients with really bad ones a couple times a week. All right, so it does happen a lot, but the main thing is what I told you about that atrophy stuff. Okay, we'll come back to that later. Here's why eating greens is so healthy. The greens contain nitrates, NO3. Okay, then on the back of your tongue, there's bacteria that convert them to nitrites. This should be nitrites, NO2. Goes down into the stomach acid converts them to NO, nitric oxide. So that's N and 1 oxygen. And then that goes into your arteries, systemic vasodilation, sort of increases the blood flow everywhere in your body. That's one of the big benefits of greens. That's also what you got when you go out in the sun, you've got nitric oxide precursors in your subcutaneous tissues that are released. That's why you feel so good when you walk out in the sun. Okay, and if you're barefoot on the beach, you feel even better because you get the negative ions from the ground coming up into your feet. That's a so-called grounding or earthing. There's something to that. We don't got time to go into all the details of it, but I think there's something good about it. Not as much as they exaggerate and say the people that are trying to promote it or sell stuff related to it, but still the idea, there's something good about that. Okay, and actually, I one time talked about the happiest you're ever going to be in your life is when you're with someone you love, walking hand in hand on the sand at the beach in the sunshine. I mean, it doesn't get much better than that. Okay, and this is also the reason why you want to avoid some of these harsh toothpastes and mouthwashes and stuff, because they'll kill the bacteria on the back of your tongue, and you can't make the first step in this conversion. So these things can actually cause hypertension because you're losing your systemic nitrates, systemic nitric oxide vasodilator effect. All right, and as you get older, your endothelial cells don't function quite as well as they used to. Now, a lot of people tell you, oh, you lost 50% of your endothelial function by the time you're 60. I actually think that's exaggerated. I think that might be true if you're eating a standard American diet, but if you're eating a plant-based diet, low-fat plant-based diet, I don't think that's true, because look at all these countries. They got the same blood pressure where they eat plant-based diet all their life, same blood pressure in their 70s as they do, in their teenage years. So if you eat the right diet, you don't age as quickly. You just don't, because your tissues are maintained. You can also get problems with hypertension if you're taking proton pump inhibitors, because you're going to decrease your stomach acid. You're not going to get as normal a conversion of the NO2s, nitrites, to nitric oxide. Okay, antacids can also do the same thing. Okay, here's your ascending thoracic aorta. Here's your heart, the left ventricle. It pumps. Systole means contraction in Greek. Diastole means relaxation. So when the left ventricle pumps, it pushes blood into the ascending thoracic aorta. The ascending thoracic aorta stretches out, and then during cardiac relaxation, diastole, the elastic recoil fibers in the ascending thoracic aorta, they contract inward and they push the blood along. So that's why the ascending thoracic aorta is called the second heart. And you want that to be good. A person who's chronically hypertensive for a couple decades, they trash the elastic fibers in the ascending thoracic aorta, and then they lose the ability to generate this elastic recoil. This elastic recoil effect, there's something called a Windkessel, which it looks like an accordion, and you blow air onto a fire, onto the kindling to help the kindling to burn. So that's called a Windkessel. That's a Windkessel. This is called a Windkessel effect. What am I trying to say here is, this is why you hardly ever see diastolic hypertension in a person over 50, because a person who's been hypertensive for a couple of decades, they've trashed their elastic fibers. They can no longer generate good diastolic flow, so they compensate by having increased systolic flow. But it's a bit of a screw job, because when do you think you perfuse your coronaries? During systole, the heart muscle's contracted. It's firmly contracted down. You can't get blood into it. It's during diastole when the heart muscle relaxes that the blood goes into it. But if you can't generate much elastic recoil, you don't have that great of a diastolic filling of your coronaries. So you're kind of double screwed. You see the double screw job? You're pumping harder because you're hypertensive to compensate for your loss of elastic fiber, meaning the left ventricle has to contract harder and longer. But you still got to perfuse it with more blood because it's contracting harder and longer, but you're not so well able to do it because you've lost your Windkessel effect. So you see the double screw job and how you can start trending into a vicious cycle there? Okay, here's a rouleau formation, which means stack of coins in French. You can also call this blood sludge. Normally, red blood cells should travel independently as it goes through a capillary. Typical red blood cell is about 7 microns. You want to know that number, 7 microns, okay? Typical capillary is about 5 microns. You might even want to hit the print screen button on your keyboard here and save this slide. There's a lot of useful information here. So basically, a 7 micron red blood cell going through a 5 micron capillary, it has to deform itself to fit into that capillary. Now, you've got what are called bridging molecules, things that stick these red blood cells together. That's LDL cholesterol. That's why high cholesterol causes atherosclerosis. Fibrinogen, the blood clotting protein. Uric acid sticks things together. And the bacterial endotoxins will lead to sticking together of the red blood cells. Things like LPS from gram-negative bacteria and lipopolysaccharide, and LTA, lipoteichoic acid from gram-positive bacteria. So that's not good. Oh, by the way, the one last thing too, you want to have, this is called laminar flow. Normally red blood cells are in the center, then the white blood cells are right there in the periphery, and where my thumbs are, that's where the plasma is. And the plasma is next to the arterial wall typically. And it's like a parabolic velocity profile on your blood flow. Why do you have this? Okay, on the outer surface of your red blood cell, you've got a negative charge. It's called a zeta potential. Now, this is like the most basic, obvious thing if you're going to work in a blood bank for transfusion. But I guarantee you, I've never in my life met a doctor who knows this. And it's so basic. It's so obvious. It's not even funny. You have to know this if you want to, be intelligent talking about blood. The red blood cells, they all have this. The white blood cells, they all have this. The endothelial cells, they all have this. A zeta potential, negative charge. It's negative charge from sialic acids, negative charge from cholesterol sulfates, negative charge from your heparin sulfates, okay? And what the reason for that is they repel each other. You don't want your red blood cells sticking together. And so what happens, though, when you get a bridging molecule, that's something with a positive charge that can stick those red blood cells together. Your IgM antibodies, those are your big acute antibodies, they can also stick red blood cells together. And we talked about LDL cholesterol being a bridging molecule, fibrinogen being a bridging molecule, the blood clotting protein, uric acid, like from eating too much fructose in some processed food, junk food. Also, the LPS and LTA bacterial endotoxins will act as bridging molecules. Okay, and excess amounts of free iron in the blood causing ferrous redox cycling and oxidative stress, those can also lead to abnormal clotting. Okay, the higher your LDL cholesterol, the higher your blood viscosity. There's a lot of people on the internet trying to say total cholesterol doesn't matter. That's all nonsense. The higher your cholesterol, the higher your risk factor of coronary artery disease and atherosclerosis in general. By the way, too, another thing you need to know, atherosclerosis is a blood clot. Okay, not to brag, but I did a fellowship with the emphasis on endovascular surgery and arteries, okay, at Harvard back in the 1990s. I have a lot of experience in blood flow. I've written numerous book chapters on the subject, given hundreds of lectures on the subject. I'm telling you, you need to know that. Atherosclerosis is a blood clot. Until you understand that, it will not make sense when you study it. And you're going to hear other things about atherosclerosis. Doctors really don't know hardly anything about it. They go, well, it's something to do with cholesterol. Maybe it's related to inflammation. It's a blood clot. And I can also tell you, I've looked at many, many thousands of CT angiograms, CTAs, and guess what atherosclerosis looks like? It's the same as a blood clot, because that's what it is. It's a blood clot, okay? You need to know that, because everything will make sense. How can a 15-year-old kid with sickle cell anemia have a myocardial infarction? He doesn't have high cholesterol because it's a blood clot, okay? All right, when you eat high-fat meals, you get thickening of the blood. So let's say this is normal blood. The plasma component is transparent. Here's the red blood cells, the hematocrit that sediments down. Here's the buffy coat, which is the white blood cells. And then when you eat a high-fat meal, it makes the plasma opaque from all the fat, all the chylomicrons, for example, and the lipoproteins. So it makes it opaque. In the movie there about sports and vegan diet called Game Changers, they had a good scene where they showed this sort of thing. Okay, this was the work of Peter Quall, cardiologist in Pennsylvania in the 1950s, and he found that if you fed patients a high-fat meal with saturated fat, starting about 3 hours to 6 or 7 hours, actually a little longer, let's say 7 or 8 hours, he would measure their blood lipid levels every 30 minutes, and then he would see if they would get chest pain, because these were all patients with known cardiac angina, chest pain related to coronary artery disease. And he found at peak lipemia, they'd have the most frequent episodes of chest pain. Kind of a daring experiment to do back in the 1950s when he had no way to treat these patients. Later on, some additional researchers repeated these experiments in the 1960s using vegetable oils. So these would be omega-6 fats, and they found they were even worse. They called worse blood sludging. And that means sticking all the red blood cells together. Okay, so, and the researchers got pissed off, the lab workers, because they would start at 8 o'clock in the morning and the patients would still have hyperlipidemia and thick blood into the evening. They wanted to go home. And then look what happens if you don't eat any of that fat. You don't ever get this thick blood. You don't get blood sludge, okay? That's a smart thing to do, eat a low-fat diet. The amount of fat in a lot of these starches is incredibly low. It's only 1% of calories are from fat in white rice. 1% of calories are from fat in potatoes. 1% of calories are from fat in sweet potatoes. 3% of calories are from fat in lentils. Okay, those are really low-fat foods. The endothelial cells, the lining cells of artery, are shaped like a spindle, and they're orientated along the long axis of the vessel in the direction of flow, so to speak. Okay, and they can sense flow direction. The most important thing endothelial cells do in terms of preventing atherosclerosis is they give off nitric oxide. Nitric oxide is a gas. It diffuses into the lumen, and it inhibits the platelets, prevents them from clotting. It diffuses into the wall of the artery, and it causes the muscle to relax, okay? So it keeps the arteries open. It's a vasodilator. Oh, by the way, you heard me say that atherosclerosis is a blood clot. And, you might say, well, how do I know? I'll tell you how I know. When I was a young guy, I used to think that people like myself, imaging-guided surgeon, interventional radiologists, and, vascular surgeons, cardiothoracic surgeons, that cardiologists, we were the real experts on atherosclerosis. We knew atherosclerosis better than anybody else. We're putting in stents. We're doing thrombolysis. Some of us are doing the vascular surgeries, plugging in grafts. I figure we're the experts. But what I learned is that's not true. The real experts on atherosclerosis are the pathologists, vascular pathologists. And the reason is they just look at it under a microscope and they go, hey, it's a blood clot. Okay, and the relevance of that is if you talk to a surgeon, you think you're going to ever have a surgeon tell you that the most important thing in atherosclerosis is diet and not surgery? No way. They would fire the guy. He'd be kicked out of the society of surgeons, okay? So he can't tell you that. If you talk to a cardiologist, you think a cardiologist is going to tell you that stents are kind of a joke? No way. He would be kicked out of the business. On the other hand, a pathologist, he doesn't care. He's got no dog in the fight. He can just say, look, it's a blood clot. Treat it however you want. So they can look at it objectively, and when they look at it under a microscope, they'll tell you it's a blood clot. And once you know that, a lot of other things will make sense. Okay, so here is the common carotid artery in the neck coming up, and it goes into a bifurcation. The way you can remember it is, see my thumb? My thumb is internal carotid. That's going up to the brain. All the little fingers, that's the external carotid. There's a bunch of branches on it. That goes to the face. All right, so this is the internal carotid here, the ICA. Here's the ECA, external carotid, and that'll have all the branches on it. But the point is the blood comes up, it hits the median divider between these two vessels at the branch point. It bounces off the median divider. There's going to be turbulent flow. There's going to be some retrograde flow. Those are retrograde eddy currents, they're called. It's normal for that to happen, but when it is excessive, it confuses the endothelial cells on the far wall away from the median divider. When it confuses them, they sense that it seems like there's a vascular injury, and they will shed their glycocalyx. Glycocalyx is like sugar coating the glycoproteins on the surface of the endothelial cells. They'll shed the antithrombotic component, and sitting beneath that are these superficial prothrombotic molecules, selectins, integrins, VCAMs, vascular cell adhesion molecule, things like that. Okay, and the red cells will stick to them, and you'll form these little clots, and you'll end up in this steady state, clot formation, clot dissolution, clot formation, clot dissolution. And if the clot gets bigger, it can block this whole artery, or little pieces can embolize distally and cause small strokes, TIAs, transient ischemic attacks. But this is where it almost always forms, on the far wall away from the median divider. And guess what? The same thing is happening all day long at all the arteries in your body. Atherosclerosis is a diffuse systemic disease. So what if you put a stent here? It's still all over the place. The only way you're going to fix it all over the place is to fix your diet. Okay, here's a little bit about what's happening with hypertension and with diabetes. So here's a normal artery, the red blood cells right here going through the capillary. See how they're bent back because they're 7 microns in diameter. Capillary is about 5 microns in diameter. As they travel through this capillary, by the way, these spindle-shaped cells in the background, that's the endothelial cell. This yellow stuff is the basement membrane in yellow. These green cells right here are the vascular smooth muscles, ones that contract and narrow the diameter of the artery. Okay, these blue circles are the oxygen, and they diffuse out of the capillary, and they go to the neuron. Okay, here's the cell body of the neuron. Here's the axon of the neuron. So this is a happy neuron getting all the oxygen it could ever wish for. Down here is a diseased capillary where there's diabetes causing thickening of the capillary basement membrane. There's hypertension, which for decades has gotten worse and worse, and it's causing hypertrophy of the vascular smooth muscle. Now these little oxygen circles in blue, they have a longer distance to travel through to make it to the axon. So fewer of them reach the axon. So you get a relative hypoxia. This is what I meant by chronic out of control diabetes and hypertension leads to damage to arterial walls, and it leads to diminished oxygen and glucose delivery to your neurons. And most Americans have this. This is not unusual. This is what the majority of Americans have. And so that's why they tend to get, mentally slower as they get older. Okay, now here I'm showing you this potassium sodium ATP pump, okay? And typically 1/2 to 2/3 of the energy in a neuron goes to this pump. So it's super important. This is basically the electrical system of the cell. Human physiology, it's so complex, and it's so sort of elegant and beautiful. It's not even funny. This thing really forms an electrical battery. And the way it does it is it will allow 2 potassiums to come in. So that's 2 positive charges, but it pumps out 3 positive charges. So 2 positive coming in, 3 positives pumped out. So you're constantly pumping out more positive charge than is coming in. That leads to a net negative voltage inside the cell, negative 65 millivolts along this plasma membrane. Okay, so that is an electrical gradient. Because you got more sodium outside the cell than inside the cell, you also will have a chemical gradient of concentration. So it's an electrochemical gradient, and you can harvest that gradient. You can use that gradient to do other things. The sodium wants to come into the cell because it's attracted to the negative charge inside the cell. It also wants to equilibrate its gradient because there's more outside than inside in terms of sodium. So by allowing sodium to come in, you can have something called a NACA exchanger. Na for natrium. That means sodium in Latin. Ca for calcium. Okay, because the most important thing with neuron function is being able to pump calcium out of the cytoplasm of the cell. So what I'm saying is this is primary active transport of ions. This is secondary active transport. Secondary meaning that it's coupled to the gradient produced by this pump. That's why this pump is so important. It's electrical power to power tons of other things in a cell. Okay, so you need to know that our ancestors ate mostly potassium, like about 20 times as much potassium as sodium, and that's exactly what you're supposed to have to make these pumps run well. And also magnesium is in the center of chlorophyll, so you get a lot of magnesium. You need magnesium for all your ATP reactions. I'll explain that in a moment. Whereas a typical American does the opposite. They eat, like 15 times as much sodium as they do potassium. They screw up this gradient. They dissipate this gradient, and then their cell plasma membranes have a weakened electrical system, and that contributes to them being underperformers in things they want to be good at. Okay, there's a guy who wrote the book about this, was Richard Moore, MD, PhD, devoted his whole life to researching. It's a great book. It's called High Blood Pressure Solution. And the gist of it was you really need at a minimum to eat 5 times as much potassium as sodium. Otherwise, your ion pumps are not going to work well. You're going to be hypertensive. You're going to be sick. You're going to be predisposed to diabetes. Okay. And it's easy to do this. If you eat plants, if you eat a plant-based diet, I probably eat like 20, 25 times more potassium than sodium. The person who has to watch out is if they have advanced kidney failure, like on dialysis or close to being on dialysis, they might not be able to handle all that potassium. But, for a regular person, it's a normal thing to do. Okay, this is just a little more neuronal anatomy. I got more things labeled. So again, here's the cell body. Here's the incoming information on the dendrites. Action potential begins right here at the axon hillock. It's transmitted down the axon. It's going to go to the axon terminal. It's conducted by sodium channels, but once it reaches the axon terminal, it'll open up these ones right here. These are called VGCC. VGCC means voltage-gated calcium channel. When calcium comes into the cytoplasm of the axon terminal, it'll activate these neurotransmitter vesicles. They will travel to the synaptic cleft, and they will release NT is for neurotransmitter, release that into the cleft, travels across to the postsynaptic neuron, and exerts an effect. Okay. I mean, the reason I'm going through all this background stuff is that you kind of need to know this to make sense out of everything else I'm going to say. So here's just a neuron in more sophisticated detail. And what I'm showing you is that once that calcium gets into the cell, it activates the neuron. Here it is again, causing the neurotransmitters, the glutamates, to fuse their vesicle with the plasma membrane and release them into the synaptic cleft by exocytosis, okay? And in general, whatever a cell does, whatever's the big mission of that cell, it will do when cytoplasm calcium is increased, okay? So it's all about calcium. You could think of it as potassium, sodium, magnesium. They're like, minimum wage manual laborers, okay? Whereas calcium's like the aristocrat. It just comes in and bosses people around. Send the neurotransmitter. Contract the muscle. Whatever that cell does as its primary thing, calcium activates it, okay? So you need to know that. And the other point is calcium is only allowed to come in and do something useful, and then it has to be shut off real fast. It's like flicking on a light switch. On, off, on, off. It has to be able to go on and off fast, okay? And that's what you need to function well. And if you don't have that, you're not going to function well. All right. So you can see in order to get this calcium out of the cell cytoplasm, you have to have these pumps working in top-notch form. And you need ATP energy. You always need energy. That's an important point. And you want to remember that. You always, 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 always need energy because the gradient is astronomical. Calcium concentration outside the cell is 15,000 times what it is inside the cell. Okay? So what that means is you cannot pump against that type of gradient unless you got a lot of energy behind you. The knockout exchanger is the fastest way to pump it out, but you're also going to pump some slower through the PMCA, the plasma membrane calcium ATPase pump. You're going to pump some into the endoplasmic reticulum. It's called the Circa pump, and they all need ATP. You need to know that. They all need ATP. All right, so the other question is, why did I earlier say you have to have magnesium to get your ATP to work? Because the reason why ATP is such a powerful molecule, adenosine triphosphate, 1, 2, 3, that's where triphosphate comes from, is you got this big honking negative charge on the phosphate. That phosphate wants to get off there. It's like a bunking bronco. And it's the positive charge of the magnesium says, whoa, hold on, not yet, hold on. So you can't control your ATPs unless you got magnesium to control them. And most people are magnesium deficient in Western countries, okay? So you want to remember that. Magnesium keeps the second and third phosphate under control. So you can imagine the typical American, they're screwed up. They're deficient in magnesium, so they're not handling their ATP too well. They got way too much sodium in their body, not enough potassium, so they're not optimizing these gradients and their function. So it's no surprise that they're cognitively slow. They're not functioning that well. Okay, now here's more detail about a synapse in the brain. Again, this is a presynaptic neuron, postsynaptic neuron. Here's a glutamate neurotransmitter. When calcium comes into the cell, the glutamate is sent to the plasma membrane at the synaptic cleft, diffuses across, it binds the receptor on the postsynaptic cell. It'll cause depolarization, meaning the plasma membrane gradient becomes more positive, and that will allow calcium to come into the cell. Okay. Actually, you should know the name of this thing. This is the NMDA receptor. It's usually called NMDAR. MDAR, we often abbreviate it. And this is what the glutamate is going to bind to allow calcium to come into the cell. The important point for us is that magnesium sits in the center of it and normally blocks this channel. The magnesium, being 2+ positive charge, is attracted to the negative 65 millivolts inside the cell because the baseline charge inside the cell is so negative, it wants to get there, but it can't quite fit through the NMDA channel. However, when you depolarize the cell, initially by binding to another receptor that lets sodium come in, this becomes more positive. The magnesium no longer is attracted, and it'll pop out of the NMDA channel, and now calcium can float right in. All right, so that's an important point. Magnesium, remember, M for magnesium, M for mellow. That's worth knowing. M for magnesium, M for mellow, okay? Because imagine you got a kid, the kid's hyperactive. The kid's probably, might be magnesium deficient, okay? Feed him some plants. It'll help the kid to calm down. All right, so you need to know that. Magnesium blocks the NMDA receptor for glutamate. Thus, it blocks excessive calcium entry into the postsynaptic neuron. All right. Other things can happen. I don't want to get too complicated, but I'm just telling you a whole cascade of things you don't want to happen can happen. If you allow too much calcium to enter the cell because you're overstimulating this receptor, that's called excitotoxicity, you start to produce an excessive amount of nitric oxide. It diffuses to the mitochondria, binds with superoxides, produces peroxynitrite, and that damages things. You don't want that. Other things can do this, like glycine phosphate, glyphosate, sprayed on the, non-organic soy. That's also an excitotoxin. Aspartame, it's also an excitotoxin. They open up this channel. So it's not just glutamate that can open up this channel. There's other things that are agonists. They stimulate this channel, and they can cause problems for you. And the typical person often is ingesting multiple of the bad things simultaneously. Okay, excessive psychological stress can activate microglia. If you got a leaky gut barrier, you're going to often have a leaky blood-brain barrier too, and you get these bacterial endotoxins, LPS, lipopolysaccharide from the gram-negative bacteria, LTA, lipoteichoic acid from the gram-positive bacteria. They'll get into the blood, they'll get across leaky blood-brain barrier, they'll irritate some of these microglia. That's going to release toxic chemicals. Because in a sense, when a microglia senses bacterial endotoxin, the little, it's sort of like a frog. It's got to, see motion, zap your tongue out at a fly. The microglia, they just know if they see bacterial endotoxin, they should release toxic chemicals to sterilize the area, to kill the so-called invading bacteria. But there is no invading bacteria. There's just bacterial endotoxins that showed up because you had leaky gut, because you didn't eat enough fiber and you were exposed to some other things probably in modern processed food that are bad. All right, so anyways, this is why you want to get your act together on all these things, because you protect your brain. Okay, there's tons of things, this is, when all the roads lead to Rome. All roads lead to Rome, okay? And what I'm trying to say is, when it comes to neuron function, all roads lead to calcium. All right, there's a ton of things that will increase calcium in that cytoplasm. We talked about psychological stress elevating cortisol, which causes increased release of glutamate. Sleep deprivation elevates the same hormones. Caffeine elevates the same hormones. Corticosteroid medications elevates the same hormone. All of these things are going to increase your cytoplasm calcium. All right. And there's other things that will do it as well. Some of these excitotoxin things, MSG, monosodium glutamate, MFG, manufacturer-free glutamate. I'll come back to that in a little bit. Aspartame. All of these things are going to allow more calcium to come in. I talked about how GP is an excitotoxin as well. Stimulants, like putting a kid on Ritalin. I think that's a totally stupid thing to do. Cocaine, it's totally stupid. Stimulants like tobacco, totally stupid. Then here's the other catch. I remember I made a big fuss about how you have to have ATP. You need energy always to pump your calcium out of the cell to keep your cytoplasm calcium under control. Well, guess what? There's a lot of mitochondrial inhibitors. There's also SERCA inhibitors. These are relatively common. Traumatic brain injury will increase cytoplasm calcium. All this electrical stuff like EMF, cell phones open up VGCCs, the voltage-gated calcium channels. They let more in. It's a long story on the pathway from ischemia, but ischemia, which is common in the brains, I just showed you those small silent strokes, that also increases cytoplasm calcium. And if you activate the no pathway, I'm not going to get into that right now because it's a little bit too complicated. That will also increase cytoplasm calcium. So what I'm trying to say is the average person has no idea that all this stuff is going on. But it's pretty commonly, I look through the charts at these cognitively impaired patients, and they'll have 15 or 20 things causing brain damage, and they're not even aware of any of them. And I also got news for you. Most of their neurologists are not aware of this stuff either. They don't learn this. What you learn in med school and residency is match the ill to the pill and send the bill, okay? It's like training in pharmacology, all right? An MD is more of a pharmacology degree than it is a medical health degree. Okay, here's a mitochondria. There's an outer mitochondrial membrane, OMM. There's an inner mitochondrial membrane, IMM, and then there's a space in between, IMS, intramembranous space. You need to know that because this is where the protons get pumped. And then the central part that's yellow in this picture, that's the matrix. Okay, and then remember how I was telling you how the human body, its physiology, it's like a genius, okay? And nowadays, the people think it's cool not to talk about God, but I think that means you're stupid because you can't really talk about this without talking about God. It's too magnificent. What I'm getting at is I just showed you the plasma membrane already had an electrical system, okay, designed into life right from the beginning. The mitochondria is essentially both an electrical power plant and it's also a nuclear reactor. And then you'll say to yourself, well, how could it be a nuclear reactor? Well, it's actually pretty obvious when you take a closer look. You take hydrogen, which consists of electrons in the outer orbitals, and it also then has a proton in its center. And what the mitochondria does is it splits the atom. So life figured out how to split the atom right in the beginning of oxygen metabolism. So it splits the hydrogen atom and it pumps the proton into the intramembranous space. So here's the matrix, the yellow stuff. You pump the protons into the intramembranous space, and then you take the electrons and you pass them down a hill like a snowball rolling down a hill. And these are progressive electron carriers that till you get to oxygen, the ultimate electron acceptor, which has the highest electronegativity, meaning the strongest desire to grab that electron. And the energy generated by like rolling a ball down a hill enables you to pump the protons out. Now you've got like an air pressurized chamber and you just let a little bit of air in. And that little bit of, which means to allow the proton to re-enter the matrix. In so doing, This is complex 5 right here. You spin complex 5, and that rotational motion enables you to take a phosphate and add it to ADP, so you make an ATP. And that's how life on Earth exists, because of that. So it's rather miraculous if you think about it. We have an electrical system built into our cells, and we also have a nuclear power plant to generate energy. Okay, that's how mitochondria work. The gradient in the mitochondria, it's incredible. Okay, it's like negative 60 millivolts. Okay, so it'd be like lightning and thunderbolts. You know, on a microscopic scale, this gradient is incredible. Negative 160 millivolts. That's astronomical. Okay, so again, you're pumping these protons down here, and you'll leak some you'll occasionally leak an electron, and if you leak an electron, it falls off the chain. It'll combine with oxygen to make a superoxide, and these get neutralized normally pretty fast. But if you start leaking too many electrons, you're going to have problems. You're going to end up in oxidative stress, because it's a free radical, meaning it has an unpaired electron in its outer orbital, and that will just be like a super ball and bounce around and react with things. And here's what I want to show you. These are mitochondria inhibitors. I knew there were some mitochondria inhibitors because I knew saturated fat in particular, fat in general, but saturated fat in particular, will tend to inhibit, complex 3. All right, and that'll cause electron transport to back up, and you'll start leaking more electrons onto oxygen. You'll go into this whole reactive stress problem. But I knew there had to be a whole bunch more. So I went through all my biochemistry books. I own like 7 of them. And I couldn't find anything about mitochondrial inhibition. I'm like, what the heck is this? This is ridiculous. So I started going through all the papers. I quickly found over 50 mitochondrial inhibitors. That's what I'm trying to tell you. Conventional doctors, they don't learn about NETs, NETS. N for nutrition, E for epidemiology, T for toxicology, and then S is for all that, spiritual, sedentary, sunshine, and all that kind of stuff. All right, so what I'm trying to say is nobody knows this. Okay, I ended up writing on this and a whole bunch of different topics, but what I'm trying to say is the typical person has multiple things. And now the first thing you're thinking is, well, are any of these common? Are they relevant? Well, let me ask you, you ever heard of Tylenol? That's a mitochondrial inhibitor, okay? You ever heard of atrazine sprayed on all the corn? That's a mitochondrial inhibitor. Hydroxynonenal, produced by omega-6 cooking oils routinely, that's a mitochondrial inhibitor. Lead, a very common toxin in all kinds of things, protein powders, lipstick, okay? F- routinely put into municipal tap water, that's a mitochondrial inhibitor, okay? It goes on and on. BPA, the hard plastic bottles, that's a mitochondrial inhibitor. These are all super common. Statins, the treatment for atherosclerosis, they give a statin for high cholesterol, and that's a mitochondrial inhibitor. Great. The most common diabetes medication, metformin, that's a mitochondrial inhibitor. So I just kind of laugh. Like a friend of mine got put on statins and his blood glucose started going up. And he's like, now everybody tells me I got diabetes. I got to take metformin for my diabetes. I said, yeah, it's great. You're a real freaking genius. You're going to be taking 2 mitochondrial inhibitors. Why don't you go low-fat vegan? He's like, maybe I got to do what you said. Maybe you're right. I'm like, well, no shit, pal. I just tell you that because that's the typical patient ends up in an iatrogenic cascade. Take this pill, have a side effect. We'll take a pill for a side effect, new side effect. Take this pill for the new side effect. Take this pill for the new side effect. All of a sudden, they're on 10 pills. Okay, I'm 60. I don't take any pills. I don't have any medical problems. Everything works. Typical processed food, they don't want it to spoil. It has to stay on the shelf a long time because if it gets returned to them, they lose money. So they put lots of mold inhibitors in there. Mold inhibitors are also called antifungals. Guess what? Lots of them are mitochondrial inhibitors. You see how they just keep adding up? This is where all your energy comes from. A routine person is inhibiting their mitochondria from at least 5 different ways, if not 10 or more. All these food dyes and processed food, lots of them are mitochondria inhibitors. The common antibiotics are mitochondrial inhibitors, aminoglycosides, fluoroquinolones, beta-lactam penicillins. Great. Excessive heavy metals, excessive iron. Average Americans iron overloaded, men in their 20s, women after they're postmenopausal. Okay. Alcohol inhibits, the mitochondrial matrix component of these metabolic cycles. So alcohol's stupid. You don't want to drink any alcohol. You should drink none. That's my recommendation, okay? Traumatic brain injury leads to inhibition of the mitochondrial matrix components. So anyways, you see what I'm saying? These are common things, and there's a whole bunch more common ones I don't even mention. Trichloroethylene, that's why I don't go to the dry cleaner anymore. That stuff's in there. That's why I wouldn't use liquid paper. Some of these cleaning chemicals will have that in there. They're bad. High fructose corn syrup will often have HG in it. I won't go near that. Oh, and here's another one that I think is funny. For depression, they'll treat depression with SSRIs, selective serotonin reuptake inhibitors. Guess what? Lots of them are mitochondrial inhibitors. So the poor person's feeling sad with low energy, and they'll give them a drug that inhibits their mitochondria. How stupid is that? Okay. As a matter of fact, I can remember back in the 1980s and 90s, there was all this irrational exuberance about the wonderful SSRIs and how Prozac was the miracle drug. Yeah, right. BS. Okay. Nowadays, you look in the journal articles, you can look this up in 5 seconds. Prozac is being considered for chemotherapy. It's such a toxic thing and causes so much cellular damage. I think that's funny. Okay. I mean, it's crazy. It's basically a chemical lobotomy. It's stupid. If these drugs weren't profitable, nobody would even go near them. Okay. The only reason anybody talks about these stupid drugs is because there's big money. You match the pill to the ill, match the ill to the pill, and you send a bill, you make money. You teach a person a vegan diet, you get nothing. Okay, so it's never going to change. Our priority is what's best for the person. The priority is not the bottom line financial of the hospital system. Unless you do that, you will never, ever, never, ever cure these diseases. And that's the simple fact is that's never going to happen. People say, oh, with the new technology, healthcare is getting better and better. Right, BS. Why are people sicker than ever despite all this technology? Because the goal is to generate profit. Somebody comes in with coronary artery disease, cardiac angina. If you do an open heart surgery on them, you make $150,000. Okay, if you put in a stent, you get $30,000 a piece. If you teach them a vegan diet, you get nothing to maybe $1,000. Okay, why would any hospital in the world want to teach the low-fat vegan diet when they're not going to make money for it? They're going to go broke, so they don't want it. Okay, the modern giant hospitals with their incredibly big buildings and all their fancy technology, that's in surgeries. They don't work. Almost everybody's sick with the same thing. They're fat, sick, and stupid. They got hypertension, diabetes, and atherosclerosis. These are dietary diseases. You can only cure them with a diet. You can't cure them with pills and surgery, okay? So no medical, surgical bullshitology is going to fix these diseases. And either the person's going to be intelligent and say, gee, I have to help myself or I'm screwed. And if they don't do that, and most never do that, they're screwed, okay? Most people don't age well. They don't do well. They never get better. They just progressively deteriorate. It's kind of sad and pathetic. It's one of the reasons why I like doing this. At least I give the people a chance. At least I can help a few of the smart ones. Most people, the truth is, they're hopeless. They have no chance of getting better. This is just showing that when you eat a high-fat diet, you activate your neutrophils in the blood, your white blood cells, and they release MPO, myeloperoxidase. It's very very positively charged, very cationic. It binds with the negatively charged endothelial glycocalyx, and it causes it to collapse down. This is kind of what I was referring to earlier, the same type of mechanism. It collapses down the antithrombotic component, and some of it is shed as well. And then now cells can start binding to the endothelium because the underlying adhesion molecules are sitting below the antithrombotic zeta potential negatively charged component. And once you move that negatively charged component, now the positively charged adhesion molecules are available, accessible to the blood cells flowing by, and they start to stick and you start forming clots. And you also, it'll cause other problems. So I just want you to know that with a high-fat meal, you do a lot of bad things. Human physiology is not designed for routine eating of high-fat meals. You'll also get more of what's called phosphatidylserine externalization. This is a common mechanism of cell degeneration. So phosphatidylserine is a phospholipid. Normally, it sits on the inner leaflet of the plasma membrane. But the more fat you eat, and the older the red blood cell gets, the more it flips to the outer layer. So you cause accelerated aging in your red blood cells when you eat high-fat diet. And it stiffens the red blood cell so it can't pass through the narrow diameter sinusoids in the spleen. Normal red blood cell 7 microns, capillaries about 5 microns. In the spleen, you got these little like sinusoidal-like capillaries about 3 microns, and they'll just catch the red blood cell, they'll trap it, and it'll get lysed by the macrophage system. So you get accelerated aging, you get stiffening, you get high blood pressure because they stiffen your red blood cells. Once they're less flexible, it takes more pressure to push them through the capillary because they're stiff. Normally, they're more deformable, more flexible. Okay. And phosphatidylserine, there's another mechanism of phosphatidylserine that's relevant to neurons and also causes neurodegeneration. We're not going to get into that right now, but just be aware of it. This concept of phosphatidylserine externalization, it's a valuable concept. These are just a bunch of different things that damage the brain. And like I said, most common things are high blood pressure, diabetes, hypertension, mitochondria inhibitors, SERCA inhibitors, traumatic brain injury. They all add up. Okay, here's leaky gut. Here's normal gut, single cell thick. The reason I got to show you this is because it relates to the blood-brain barrier. So single cell thick, the gut is called the enteric tract. These are enterocytes, the single one cell thick lining. The TJs are tight junctions. And the way it works is you eat fiber, these smiley face bacteria, they convert the fiber into short chain fatty acids. Most importantly, 4-carbon butyrate, which is just a 4-carbon carboxylic acid. Think about butane, and you just throw carboxylic acid on it. Butanoic acid, butyrate. All right, and it uses that to make tight junctions. And these tight junctions prevent anything from sneaking through that gut lining. So you need tight junctions. It's absolutely essential to prevent leaky gut. Well, guess what? If you don't eat your fiber, then you're screwed. You can't make these tight junctions. And then there's a whole bunch of things that are toxic to your gut lining. Alcohol is toxic to it. The emulsifiers in processed food are toxic to it. Excessive psychological stress, excessive caffeine, the herbicides in non-organic food. Excessive dietary fat also ends up being toxic to the intestinal lining. Some of these other chemicals like carrageenan, which is often a way to hide free glutamate. Citric acid isn't really citric acid from a citric fruit. It's a chemical that's made that often gives you increased free glutamate. NSAIDs, and there's a whole bunch more. I got them all listed here. Like if I had autoimmune disease or was worried about clotting in my blood, I would want to make sure I was avoiding all of these as much as possible. Okay, so what happens when you don't have tight junctions? The bacteria make endotoxins like LPS, lipopolysaccharide it's called, and that can now get through the gap in the tight junctions, and it will interact with your immune system, which sits right below this single cell thick, and it will cause an inflammation reaction in your gut. Some of it gets into the blood, and it predisposes the blood to clotting. In addition, big protein chunks from animals get in, and they can cause autoimmune disease. So you don't want leaky gut. The lack of butyrate availability means that you don't got butyrate. If you don't got enough butyrate for your gut, you're really screwed in your brain, because now you're not going to get enough butyrate to your brain, and it also uses butyrate in the brain to make tight junctions. So you're going to have a leaky blood-brain barrier predisposing you to brain fog. Okay, and then LPS will potentially, and LTA, which is just like it, is going to have increased access to your brain. Okay, so here's why do I care? Why did I make such a big deal about LPS and LTA? Because when they get into the blood, they cause problems, okay? It's like, remember the cat in the hat thing 1 and thing 2, just causing trouble all over the place? All right, so you got fibrinogen, which is a protein. A secondary protein structure is like an alpha helix. Think of that being like a slinky, cylindrical. When you get LPS and LTA, they have like the non-stoichiomic effect. They're just a catalyst. They change the cylindrical shape of the fibrinogen blood clotting protein to being like a beta-pleated sheet, secondary protein structure. It's flat. And then they stack up and they bind with each other, the stacked up molecules of fibrin. And the bigger the molecule, the more likely it is to precipitate out of solution. To precipitate out of solution means to clot. And they're not only do they clot, but they form a refractory clots, difficult to lyse, difficult to dissolve and break apart. And so these can plug up little arteries. And I actually think that this is a major contributor to a lot of cardiac disease and to a lot of cerebrovascular disease. Let me explain. You've probably heard, if you've studied coronary artery disease at all, well, this lady, she had what seemed like a heart attack, and she's got a little bit of congestive heart failure, but she went for a cardiac cath, coronary artery angiogram, and her coronaries were clean. I wonder what's going on. Well, maybe she's got microvascular disease, syndrome X, okay, meaning that the intramyocardial or the penetrating arteries are plugged up, even though the big ones on the outer surface, the epicardial coronaries, left anterior descending, left circumflex, left main, okay, those ones are open. You get it? You can plug up your microvascular with tiny little dense matted deposit clots from this. They call it amyloid clotting when you change from alpha helix to beta pleated sheet and you form clots. This is an important thing to know. Viral infections can do this as well. Excessive free iron undergoing redox cycling in the blood, this will do it as well. How many people have this? Tons of people have leaky gut. Tons of people have elevated free iron. Most men over 25 years of age have this. Most women over 55 years of age have this. So they're predisposed to these problems, okay? So that's what I'm trying to say is the typical person says, what's my problem? You got one problem, and I got to fix that. Okay, I'll do it, okay? But it's not like that. It's more like the typical person has about 15, 20 problems, and they got to try to fix all of them. And if you're aware of them, most of them are fixable. So you just got to make the effort, okay? This is just showing normal clot, the fibrin clotting proteins. They look like little pieces of spaghetti, and you can dissolve those very quickly when you need to. But these dense clots, the ones due to amyloid clotting from the LPS and the LTA in the blood and the excessive free iron in the blood, they cause dense matted deposits. These are irregular, thickened, and it's harder to dissolve them. Okay, those two people, by the way, they did great research. Her name is Etheresia Pretorius from South Africa. His name is Douglas Kell from England. They both deserve a Nobel Prize, but they'll never get one. They'll never get anything. Anybody who does anything relevant to nutrition never gets anything because they don't want the public to know about it. All right, here's ferrous redox cycling, meaning that iron is a transitional metal, has a variable valence. It can be routinely Fe2 plus or Fe3 plus. It actually can have other valences, but those are the most common ones. And it can cycle back and forth between Fe2 plus, Fe3 plus, Fe2 plus, Fe3 plus. And it can hand off electrons. That's why it's useful in an enzyme active site. That's why it's useful in hemoglobin, is that it can vary its valence. But You don't want free iron anywhere else, okay, besides in an active site of an enzyme or in your hemoglobin, because when it gets into other locations, it's freed up. We store a lot of iron in case we bleed and we need to replenish our hemoglobin fast. But in the modern world, because iron was scarce commodity to our ancestors from 1,000 years ago, but now it's so common, Americans are iron overloaded, and this excess iron, some of it leaks into the blood. Now you got free iron in the blood. It starts causing trouble, making all these free radicals. You get antioxidants from plants, things like vitamin C, vitamin E, glutathione. You get vitamin D from sunshine. What that's all about is, imagine you're out in the hot sun in the middle of a field. It's 100 degrees outside. The plants can't go anywhere. They have to sit in the hot sun. The human can walk under the tree, smile, and get some shade. But the plant has to fight the excessive oxidative effects of the sunshine by having chemicals called antioxidants. So when you eat the plants, you get the antioxidants. You don't get them from an animal because the animal uses them up. The point I wanted to make about that iron is like a fire. There's a guy named Ed Weinberg. He had a clever quote. He said, iron is like fire. It's good to have it where you need it, like in the stove or in the furnace. But you don't want free iron anywhere else because it destroys things, all right? All right, so here's the point I make. This is some of the experimental work of Etheresia Pretorius and Douglas Kell. They showed that this is amyloid clotting, stains for amyloid clotting. And I said it's like the 4th of July grand finale fireworks. Normal control, you got next to nothing. LPS, tons of abnormal, this sort of like aquamarine blue. Iron does the same thing. LTA does the same thing. So basically, you don't want leaky gut and you don't want to be iron overloaded. Okay, where do you get iron from? Excessive amounts of meat, you know. Heme irons absorb much more than plant iron. All these iron-fortified foods, they'll iron overload you. High-fat diets cause brain fog. There's a bunch of papers on that in rodents. It makes the rodents stupid, decreases their memory and their mood. You ever notice how the carnivores on the internet are so rude and vulgar? They come to the vegan sites and they say all kinds of nasty things. Whereas the vegans, we don't care about the carnivore sites. We're like, you idiot chumps, you want to plug up your arteries, go ahead. We don't care. What I'm trying to say is vegan diet or vegetarian diet at least makes people behave better. It does. And there's reasons for that. We're not going to get into all that right now, but it does. Okay. I told you before, there's a really interesting book by the name of Food and Behavior. The author's name is Barbara Stitt. She was a probation officer, and she noticed that almost all of her clients who had been arrested were junk food junkies. Okay. And she herself had problems with rebound hypoglycemia and, you know, volatile moods. And then she started eating more of a plant-based diet. She wasn't a full vegan, but she ate more and more of a plant-based diet. And her hypoglycemia, rebound hypoglycemia episodes went away and her moods dramatically improved. So she started putting her probationers on it. So the book is called Food and Behavior. And the point of it is that typical probationers had about a 70% rearrest rate for similar crimes within 3 years. Of her clients, only 11% at 10 years, at about 10 years. So dramatic improvement in outcomes. And I'm saying the vegan diet makes people nicer and more mellow. Okay, also here's the point, like I was telling you earlier, that the fiber, short-chain fatty acids, the butyrate, it travels to the blood and it's used by the brain to make its blood-brain barrier. And so that's why if you've got leaky gut, you've got a good chance you got leaky brain too, and you don't want that. It can make you stupid, give you brain fog, okay? Also, something that injures the brain, like a stroke or traumatic brain injury, that will also tend to cause leaky gut. And that's why I've told the neurologist, you know, I actually teach neurologists, and I tell them, you got to rewrite your guidelines for post-stroke and post-traumatic brain injury to include a lot of dietary fiber to protect the gut barrier and to protect the blood-brain barrier. They don't know this. Believe me, they don't know this. They don't know anything about nutrition. And they actually really don't know much about excitotoxicity either. It's just not in their books. I own the big, thick Ivy League neurology textbooks. It'll be a joke. There'll be like 2 paragraphs in the entire book, one in the context of epilepsy, one in the context of post-stroke on excitotoxicity. It should be about, 100 pages at least. It's important stuff. Okay, here's just briefly Tetsumori Yamashima, a Japanese guy, given the task of figuring out why are so many Japanese people becoming demented. And he figured out because they're eating too much omega-6 coconut, too much fried food, and it's making their incidence of dementia is going up off the charts. Here's a proof of polyunsaturated fatty acid. Here's the carboxylic end. Here is the methyl end. There's just a methyl group over here. And you count the carbons, 1, 2, 3, 4, 5, 6. Carbon number 6, there's a double bond. So that's an omega-6 fat. There's going to be a skip carbon in between, and then there's going to be another double bond. So it's a PUFA, polyunsaturated. So it's poly, there's more than one double bond. The carbon right here is going to have 2 hydrogens, one going below, one going above, and that's called a methylene group. And this one, because it's in between 2 double bonds, it's called a methylene bridge. This hydrogen is not very tightly held. It's at high risk to get plucked off. When it gets plucked off, it'll cause lipid peroxidation. I just want to show you one more slide. This comes from a guy named Chris Knob. He's a real smart ophthalmologist, and he's given lectures about why are people so sick. And what was interesting was he showed that the correlation with increased obesity and diabetes, it's tight with vegetable oils, meaning omega-6 cooking oils. And Tetsumori Yamashima agrees with this. He said people were eating way more sugar way back around 1900, and there was no spike or change in your diabetes or obesity in a significant way at that time. He says it correlates tightly to the omega-6 cooking oils. So that's important. Now, don't get me wrong. I don't think omega-6 cooking oils are the whole story, but they're a major part of it. Okay, hydroxynonenal is a toxic aldehyde. I'm not going to go into too much detail about it, but just so you know, that's the Tetsumori Yamashima theory. It's called the calpain-cathepsin theory because those are intraneuronal proteases that destroy the cell in the setting of excessive omega-6 diet. Okay, here's a lipid peroxide where there's two oxygens next to each other. It's called a peroxide. Okay, and then these are the calpain protease and the cathepsin protease. We don't need to have time to go into all this stuff, but it's going to lead to destruction of the heat shock proteins. Okay, so that's his theory. And the bottom line is this: you don't ever want to eat oils. Never, not one drop. Don't eat anything with oil in it. Okay, and they're all bad, every single one of them. You hear the word oil, you should think bad. Okay, PFOA, like on the nonstick cooking pans, they are associated with increased risk of diabetes, damage to the pancreatic beta cells. I won't use those no-stick pans. Okay, a lot of people do. A lot of people, even my family and relatives do. And basically, a lot of them, they'll ignore me. But, time goes by and they'll go, gee, why are you so healthy? Why are you so smart? I go, because I don't eat like a dummy like you with all this fried food and all this other stuff. Okay, another thing came out of this. This guy, Seralini, is a real famous researcher for these estrogenic chemicals. And what he found was interesting, that 80% of these estrogenic chemicals, they're also neurotoxic. So he said, don't even call them EDCs, endocrine disrupting chemicals. He's call them ENDCs, endocrine and neurologic disrupting chemicals. They cause brain damage. And the ones that don't cause brain damage quite often cause thyroid damage, which can cause brain damage. So you're still screwed with them, all right? And meat products have a lot more of these estrogenic chemicals. But there's other things, a lot of personal care products. That's a topic for another day. But all I'm telling you is all this estrogenic chemicals, they're bad. And there's tons of them. And they're real common. They're ubiquitous. I said this before. A good way to live is like Adam and Eve, but keep your indoor heating and plumbing. Genesis 1:29, every plant will be food for you. Okay, protein supplements. You can look at Consumer Reports. This one's 2018. There's other ones. They're a lot of times got heavy metal contaminants. A lot of chocolate has heavy metal contaminants. Cortisol, we talked about, it increases glutamate in hippocampus. Okay, here's how it does it. Cortisol, I'm almost done with this lecture. I know it's kind of going on, but there's a lot of material here. Cortisol will cause increased glutamate release into the synapse. So does voltage-gated calcium channels. EMF will do this, holding the cell phone next to your head will do that. Okay. So what I said, people say, oh, well, can cell phones cause cancer? I almost never see a brain cancer. It's super, super, super rare. So I wouldn't worry about that. But do I see demented people, memory loss, stupid people all day long, every day, tons and tons and tons of them. And so use your speakerphone. Okay. It's better. Don't hold it up to your head. Okay, they put tons of this stuff, manufacturer-free glutamate in the form of MSG in the food because it tastes good, lots of sodium in the food, lots of high fructose corn syrup, lots of fried food. All these things taste good. The company who seeks the bliss point when they have the public comes in as research subjects. So you don't ever want to eat processed food. I'll never eat anything with more than one ingredient because on the second ingredient, they can add other chemicals and not tell you. And all this stuff is just loaded with flavorants to get you addicted to the food. So you buy it and eat it like a chump. And then it's going to have mold inhibitors that are mitochondria inhibitors. This lady, her name is Catherine Reed, and she was a protein biochemist, and her daughter got autism. So she heard somewhere that reducing the amount of glutamate in the diet can help protect the child. And so she became a scholar of glutamate. And what she found out is tons and tons of it is put into the food. And once she got all this stuff out of her daughter's diet, her daughter came back to normal. She wrote a book about it here, Fat, Stressed, and Sick by Catherine Reed, PhD, protein biochemist. Her daughter came back to normal. I saw the videos of it. I believe it. She's been checked out by a lot of people. I think she's for real. Okay, so here's a protein. The G is for glutamates. And all these individual amino acids are bound by peptide bonds to each other. You can cleave these peptide bonds. And once you cleave them, through anything that processes the protein will cleave a lot of these. Fermentation does it. Fat separation, pasteurization, enzyme lysis, extracting the protein, so to speak, hydrolysis, and then you free up the glutamate. That's what MFG means, manufactured free glutamate. That's the most common way to free up glutamates now. They'll take a baseline protein, like gluten, for example. It's called gluten because it's got tons of glutamate in it, 25%, meaning every fourth amino acid residue is a glutamate. There's lots in casein, soy, and whey. That's another reason why a lot of people eat these proteins for like bodybuilder muscle, and it comes from these things. It's got tons of free glutamate. I would never eat that crap. Excitotoxin. Another thing, you'll hear people trying to protect glutamate. They go, well, the brain has a blood-brain barrier. Therefore, when you eat excessive amounts of glutamate, it's not a big deal because it can't get in. BS. You got what are called the circumventricular organs. They're chemosensors located around the ventricular system of the brain. And they don't have a blood-brain barrier because they're sensing the chemicals in the blood. So it can get into these areas and then potentially get into adjacent areas. Plus, lots of people got areas of blood-brain barrier breakdown due to hypertension, diabetes, ischemia, trauma. And also due to leaky gut, they don't got enough butyrate getting up to the brain. I'm not going to go into all these details, but these are some of the insights that came from her book, Fat, Stressed, and Sick. The bottom line is this. If you eat processed food, it's probably loaded with free glutamate, and it's bad for you. And so that's why I would never eat processed food. You can read all this if you want, but that's what it comes down to. Okay, and then other things I thought were interesting. This is a thesis paper of a PhD, candidate in research, and they came to the conclusion MSG increases cortisol. And what that means is you can get a vicious cycle effect whereby just the excessive glutamate is increasing cortisol. Cortisol is increasing glutamate. You see the vicious cycle there? It's not good. Excessive dietary salt increases sympathetic autonomic nervous system, which increases glutamate. Okay, so all these things are going together. What's the typical, American chump doing? They're eating real high sodium food that's very high in fat, that's loaded with free glutamate. This has a toxic effect to their brain, making them stupid, plugging up their arteries and overstimulating their brain. A double screw job. So plugging up the arteries with atherosclerosis, high-fat diets, and blood sludge drops the oxygen glucose to the brain neuron, and then the stimulants in there like the glyphosate, the aspartame, the glutamate, they increase the metabolic activity. The farther this metabolic activity gets, metabolic rate, from the amount of oxygen and glucose delivered and the ability to produce it, like mitochondrial inhibitors also drop the net effect of energy production, you are going to likely have these neurons just going into apoptosis and dying. That's actually my theory. That's the Peter Rogers, MD, supply and demand theory of neurodegeneration, okay, which explains what's going on. This is just more of the same. Here's a simple way to remember. Rosie, R for Rogers theory, O for oxygen and glucose delivery problems, S for stimulants, ramping up the metabolic rate of the neuron, I for inhibitors of mitochondria, dropping the ATP production in the mitochondria, dropping the function of the circle pumps as well, because then you can't make ATP, and you can't sequester your calcium in the endoplasmic reticulum. Your neuron's screwed. That neuron's going to die. So I call it supply and demand theory. You could also call it overworked and underpaid. So basically, you start out, you should have neurovascular coupling, meaning your metabolic rate is equally matched by oxygen glucose delivery and by mitochondrial energy production. If you drop mitochondria, now you're creating a gap between what the cell needs and what it gets. And if you drop oxygen glucose delivery further, and then you give a stimulant, you keep widening this gap. The wider this gap gets, those neurons die. So the question you're probably asking yourself is, how is any of this useful to you? Well, it's pretty obvious, isn't it? Don't eat a high-fat diet. Don't add excessive amounts of sodium to your food, okay? Avoid all these processed foods that are full of toxins and mitochondria inhibitors, okay? Don't smoke. Don't drink caffeine. Get your sleep, okay? Don't give your kid attention deficit amphetamines, okay? It's against the law to sell amphetamines to a person, but we give them to a school child. It's insane, okay? There's more to it. We don't got time to go into all of it. I actually wrote a poem, made a mnemonic. It would have been easier if I went clockwise, but I went counterclockwise. This is how I drew it. Are your pumps working? Oxygen glucose delivery. Do you have an oxidative stress problem? Do you have excitotoxins? Do you have mitochondrial inhibitors? Do you have microglia related problems? These are the things that will cause brain damage, okay? And they all just fit into my theory. Here's a simple little, I call it the Spartan vegan thing. And it's basically, a low fat, low sodium, 100% vegan diet, 100% whole foods, 100% organic, no oil added. And the main source of your calories should come from starches. After that, some fruits and some veggies. The only thing you need to take is vitamin B12 typically. And then, get your social stuff in order. You had to have some social support system, get your exercise, get your sleep, get some sunshine. People who are religious have more of a sense of meaning and purpose in their life, and they're healthier. And that's basically it.
Well, thank you very much for that, Dr. Rogers. It was a lot of information, and I think a lot of people are going to probably want to watch it again so that they can catch it on the replay. Everybody, go ahead and click like for Dr. Rogers. He put a lot of work into this, and he's done a lot of research and made come up with some really great theories and information. And I'd like to now open it up for questions, and we do already have some that came in. And Thanks wants to know, is it best to learn something new right after exercising?
Well, it's okay. I mean, I can see where you're going with that. That maybe theoretically their BDNF is elevated, brain-derived neurotropic growth factor. If you feel like it's okay, I don't know if it's that important, but I mean, it's a reasonable thing to do. What I have found to be very helpful, because I spend a lot of time in very intense academic environments, is as soon as I get up out of bed in the morning, I just go right to my desk and I start doing academic work, because you're smartest first thing in the morning. So I think the most important time to do cognitive work is as soon as you wake up. Because also what I've seen happen is if you start doing other things, well, I'll do the dishes first. Oh, I'll do my laundry first. Oh, I'm going to go exercise first. One thing leads to, oh, I'll eat breakfast first. I'll have a cup of coffee first. The more time you waste before you sit down at your desk, the less work you're going to get done. The other thing I know is usually my maximum brain function is about from when I wake up till about 2 o'clock in the afternoon, 1 o'clock in the afternoon. So if I, piss away the morning doing all kinds of these sidetrack things, I'll have less time to do top-level academic work. Now, I do know, for example, where does exercise come into play as well for learning? Imagine you're reading a book and you start spacing out. You're like falling asleep, or you read the paragraph. You don't remember what happened when you get to the bottom of the paragraph. If you get up and walk, you become more attentive and you'll understand the paragraph. And I think that relates to, what's the purpose of the brain? Walk down a path in a forest, a jungle, a prairie, and survive, such that when you're walking, you better be paying attention or you're dead, and a predator will come out and get you. You'll trip and fall over something. So what I'm saying is your intellectual attention system is automatically heightened when you are walking. So I found that very helpful to read while walking a lot of times to perk up my attention in a book.
Very good. And WJ said, what is the role of omega-3s in brain function?
I laugh at this omega-3 stuff. I think it's BS, just so you know, because I know it's being hyped right now. There's a lot of people trying to sell omega-3s and promote them. And I know there are some research studies that in a limited way suggest they might be beneficial. I think the whole thing's bogus, just so you know. And you'll say, why do I say that? How could I say that? Well, it's liquid fat. That's a highly processed chemical, number one. Number two, it promotes obesity. Liquid fat promotes obesity. Number two, it promotes insulin resistance. Okay, so it promotes diabetes, all right? And things that promote obesity tend to lead to hypertension over time. It's an immunosuppressant. You really want to suppress your immune system. It increases the risk in men. It's proven. There's been a bunch of studies that it increases prostate cancer. Anything that increases prostate cancer probably increases breast cancer, okay? So I think it's stupid. In animal studies, it increases metastatic disease of the liver, for example, all right? Also, I've seen like 3 studies. It increases atrial fibrillation. Okay, so you're going to tell me something's going to lower your risk of being demented if it increases your risk of obesity, of hypertension, of atrial fibrillation, of cancer. Sounds like BS to me, okay? I know there are some people who sort of, massage the data to say, well, look, we got better cognitive function. I think that's BS. Can you remember something from when you were 3 years old? Yeah, why? Because your neurons don't turn over. You got the same neurons sitting in your brain as you did when you were 3 years old. They don't need that much omega-3s. They can convert, ALA, alpha-linolenic acid, into the long chain EPA and DHA. If you take a PUFA with multiple double bonds, especially these long chain omega-3s like EPA and DHA, they will go rancid in room temperature, yet alone when you put them in your body, 98.6 degrees, they're going to go rancid pretty fast, and you're going to end up with all this lipid peroxidation problems. Why do you think they have you store them in a bottle that's radio opaque and put it in the refrigerator right away? How much of them are lipid peroxidized when you first buy them? I'm just not believing it. The gelatin is often contaminated. How do you know you don't got mercury contamination in them? I think it's just, another thing is fun to sell, make money off of, but I think it's bogus. I'm not buying it. I think the research that's been done on it is subopt.
Okay, well, thank you for that. You can see, I think I had another question. So somebody asked about, just give me a second to get to it. Oh, so Brad said, regarding the Windkessel effect, can you regenerate the elastic recall? I'm whole food plant-based, trying to get off blood pressure meds. What is the highest diastolic number that is safe without medication?
Well, you're not going to get those fibers back, but you can do a lot of things to make life easier for your vascular system by lowering your blood viscosity by, number one, eating a low-fat diet so your red blood cells aren't stuck together by the fat. That's going to make your blood more like water instead of like a milkshake, so you're not going to need to pump at such a high pressure. By eating lots of fiber so you don't get leaky gut, you're going to avoid all that amyloidogenic type clotting. It's going to keep your blood thinner so your pressure doesn't have to be so high. So that's what you want to do. Avoid the excessive sodium so you're not vasoconstricted. Eat the plants so you get all the vasodilators, the potassium, the sodium. The potassium, the magnesium, and you get the nitrates, precursors. Okay. Try to get out in the sun a little.
Okay.
That's what I would do.
And the part 2 about the highest diastolic number that is safe with that medication?
Well, I think that depends. Whatever you feel good about. You want to be careful about dropping that diastolic too low because you might not be perfusing your coronaries or your brain so well. I wouldn't worry so much about that. I'm not an expert on thinking about diastolic numbers in particular. I'm not a big, in general, the lower the blood pressure, the better, as long as you feel good at that level. There's people in these countries where they ate plant-based all their life. They are in, 70 years old with pressures 90/60. For an American, you would think they were in septic shock, okay? But if the person's healthy and they've always had a low pressure, they can be fine like that.
That's about what my blood pressure is. Anytime I see a new doctor or nurse, they just kind of, yeah, that's normal. Don't worry about it. Okay, let me just see. Oh, well, Mona, I don't know if Mona heard your answer, but she was talking about flaxseed.
Nah, I don't believe all this stuff. You have to remember, I know flax has gotten kind of popular, and I'm also going to tell you, I haven't studied it that much, but here's my feeling on it. Why would I want to eat all that fat? It's super fat, and flax seeds are super estrogenic. It's like soy is thousands of times more estrogenic than other foods, and flax is like much, much, much more estrogenic than soy. I don't have any need for it. I know they say it has a little bit of fiber. There's plenty of fiber in other plant foods. Why would I want to chase flax around? Now, don't get me wrong. I do know there are some pretty good people that think flax is okay, but I've never seen anybody show me anything about flax to make me want to chase it. Like I said, I don't like estrogenic. I'm an old-fashioned macho man, college wrestler. I like being masculine, okay? I see no desire to seek out all this estrogenic stuff, okay? None, zero. It's like, why would I want that? It's fat, that's bad, and it's estrogenic, that's bad. I have no interest in it.
Okay, thanks for that. And I just wanted to put this at the hyper and said, thank you, Dr. Rogers is a brave and brilliant man. So just thought I would put that up there.
Oh, yeah, I want to just add one more thing. I realize there's different types of estrogens, and these are not human estrogens, like estradiol, for example. But still, they are activating the estrogenic pathway. And I have seen papers like the Stefan Mueller paper that soy activates both the estrogen alpha and beta receptors, including the so-called bad effects, okay? I don't know as much about the flax estrogens. It might be a different type of phytoplant estrogen, but I'm still saying, in general, estrogen chemicals in general, they tend to cause weight gain. The idea of it is when a woman's pregnant, her estrogen levels go up and they tell her to gain weight, to store that weight for the baby might need it for energy. So in general, estrogenic chemicals mean to help an animal gain weight, fat storage hormones. I don't want that, okay? So I'm just letting you know that in general, estrogen chemicals, like in a woman, increased estrogen is associated with increased risk of autoimmune disease. Anyway, that's not something I want. So.
Well, Green Warriors, please click like for Dr. Rogers. Again, he really put a lot into this presentation, and I'm sure we learned a lot today. And I would like to ask Dr. Rogers if you could tell us about what you do and how we can find you on social media.
Oh, yeah, I have a YouTube channel. It's called Peter Rogers MD, and I make a lot of videos about whatever topic is kind of catching my interest. My background now, I mostly work in the neurosciences. I started out as an imaging-guided surgeon, and then I switched to becoming primarily a neuroradiologist. I still do a little bit of imaging-guided surgery and other stuff, but that's the main thing I do. I'm most interested in the brain. I'm currently been studying a whole bunch of stuff about the effect of food on personality and psychiatric disease. I found that kind of interesting. But anyways, yeah, and I've written a whole bunch of books. If you go to Amazon, I've written about 20 books. Probably the funniest one would be A Tale of Two Toes in a Hot Tub. That one's real funny. It's about a smart patient and a stupid patient and how they go through the system and what they do. My Medical Reformation is probably my best overall book, where I summarize. Basically, I rewrote the internal medicine textbooks. And then I've written a whole bunch of other ones. You know, the ones with color covers tend to have more pictures, because I didn't know how to make pictures originally. So when I started out, it was all prose and maybe some line drawings. But then I figured out how to make color pictures on the ones done in the past year or so, and those are more fun, I think. So that's basically it.
Okay, well, thanks for that. And go ahead and check that YouTube channel out. We have quite a bit of interviews, because we've been having Dr. Rogers on monthly. So he's done a lot of different presentations here. We even have a dedicated playlist to Dr. Rogers' presentation, so that you can just find it very easily and peruse through it. Well, thank you, Dr. Rogers, for sharing your invaluable insights on how we can take action today to prevent dementia and protect our brain health.
Yeah, that's kind of what I was saying. Is basically everybody thinks you're screwed. You get older, you just become demented. Isn't it sad? And what I basically said is these are knowable things, and you just avoid them, and you're unlikely to become demented.
Yes, absolutely. It's so good to know. It's so encouraging. So, Dr. Rogers, what is your final take-home message for our Green Warriors?
Yeah, again, I sort of say it comes down to, you want to live like Adam and Eve, but keep your indoor heating and plumbing. Be simple. Eat whole foods, things that grow outdoors. We're made to walk around all day in extended family groups looking for something to eat, eating plant foods.
Yes. And we're so fortunate that we have a lot of access to so many of these. Well, Dr. Rogers, what would you say your final take-home message for our Green Warriors is today?
Well, I mean, the big neurodegeneration theories are, number one, I told you about Delatore's theory. So you want to avoid hypertension and the things related to that, because they just lead to problems. Number two, I told you about the Tetsumoto Yamashima theory. Don't eat any oil. Oil just destroys your blood vessels, okay? Number three, don't have leaky gut. You end up with the Kellin-Pretorius problems of amyloidogenic clotting. Number four, recognize what I told you. Avoid processed food, because you end up giving stimulants to your neurons, ramping up their metabolic activity while simultaneously inhibiting your mitochondria, okay? So it's a screw job. Your neurons are screwed. You're telling them to do more work, but you're lowering the amount of energy that they get and screwing up their mitochondria and their circuit pumps. How are they going to make it? They're not. And as soon as a neuron can't meet its metabolic demands, it goes, screw it, I give up, and it dies. So you got 100 billion neurons, don't waste them, is what I'm saying.
Very good. Well, Green Warrior, tell us what you're going to remember from what you watched today, and what your takeaway message is. And one of my takeaways is that the same thing that causes leaky gut can cause damage to your blood-brain barrier. So it's just a win-win whenever you take the action to eat the right foods and have a healthy lifestyle. You can prevent a lot of these things. I also wanted to thank Jess Task Voice. She did the promos and she did the countdown, and she's just been so helpful in getting the word out about our channel. And I'm really excited because Jess Task Voice is going to tell us who's coming up next.
Looking to make your Halloween celebration healthier without sacrificing fun? Rick's whole food plant-based SOS-free recipes are the perfect way to serve up nutritious, crowd-pleasing treats. Join us on Wednesday, October 30th, 3 p.m. Eastern, noon Pacific, on Be Green with Amy Live.
Well, I want to thank you, Green Warrior, most of all, for joining us today. Your engagement and your support make these discussions meaningful and impactful. And I really hope you're feeling inspired to take a closer look at your food choices and make some positive changes for your health and your well-being. Remember, every bite that we take is an opportunity to nourish our bodies and, like Dr. Rogers, become the healthiest versions of ourselves. And so please stay tuned for more empowering content. Please subscribe to my channel and check out Dr. Rogers' YouTube channel as well, and share our message with others who you think can benefit, because together as Green Warriors, we can make a meaningful difference in the world. And as a special thank you to all of you, I am offering you 5 free recipes. So if you go to my website, begreenwithamy.com/join, I'll send you 5 free whole food plant-based, no added sugar, oil, or salt recipes to make another addition to your delicious recipe collection. And I do want you to join me, if you would, with Dr. Rogers, and he's going to say my tagline with me, and you can type it in the comments below. Are you ready, Dr. Rogers?
Yes.
Okay. Well, until I see all of you again, remember, be strong, be well, and
be green.
Thank you so much, Dr. Rogers. Thank you, Green Warriors. Take care, and we will see you all soon.
Now you can listen to Be Green with Amy expert interviews wherever you go. Listen while walking, meal prepping, or traveling. Find Be Green with Amy on Apple, Google, Alexa, Amazon, or virtually anywhere you find podcasts. Be strong, be well, and be green with Be Green with Amy.